cybersecurity of medical device or IVDs so important? The key outcomes out of this workshop will be: bring awareness and understanding of cybersecurity in medical devices, understand requirements defined in regulatory frameworks globally, pre-market management of cybersecurity, post-market management of cybersecurity, cybersecurity for networked medical devices, necessity to carry out the scans, penetration tests, or other security tests throughout the whole life cycle of a medical device, risk management process, tests to verify and validate the security implementations and security risk mitigation measures. So, all in all, lots of learning through this workshop. And before I call the two experts of this, I would like to know that there is a surprise element in this workshop, and I'm sure you're going to just love it. So please help me welcome with a big round of applause, Mr. Dhruv Pandit, Founder and Director, Heritage Cybersecurity. Welcome, sir. We have with us Ms. Sivani Pisapati, Director, Cybersecurity, GE Healthcare. Please help me extend a warm welcome to her as well. So now the floor is theirs and yours. So enjoy the session, and the surprise element will definitely bring big smiles on your faces. Thank you.
Hi everyone, hope I'm audible. Hi, I don't see the energy. It's cybersecurity. Can I get a thumbs up? Thank you. A very warm welcome to all of you to the cybersecurity workshop for medical devices in India MedTech Expo 2023. I'm Shivani. I've been with GE for almost 17 years now. I started my career as a C++ Java developer. Took up incremental roles. I was part of a platform team which was the base for CT, MR, X-ray, Mammo, NukeMed, all the scanners. It gave me an immense exposure to understand how these scanners work, and I was able to get in, understand. I can tell you that it gives us immense pleasure to work for a global global healthcare organization, because when by the end of the day you go back home, you go with a huge satisfaction that you've been able to make a small difference in the life of someone suffering at the right moment by providing the right healthcare solutions at some part, some corner of the globe. I have here two of my colleagues, Abul and Bhaskar. Baby. So they are also here with us. So today we are going to do a cybersecurity workshop with you. So while I was talking about myself, back in 2015 is when I took a small pivot in my career. I was doing very well. I could have taken a big role, but I thought, no, I need to change the domain. And I'm very happy that I took the decision to take up a role in cybersecurity. And because the immense importance that this domain has in the healthcare industry that we are going to discuss in a while. Why cybersecurity in healthcare? Why are we talking so much about it? So, to start with, for any country, the people are its biggest strength. So if you are attacking the health of their people, if you are going to delay the treatment of the people, that's where the problem is. And that is the biggest motivation for any state actor to go ahead and attack a healthcare device or a hospital or a service provider. Again, adoption of digital technology in healthcare. With COVID, with the onset of COVID, and even before 1 or 2 years, it was the build-up was too much. We were all doing a huge shift technologically in the medical devices. Healthcare was going through a tremendous shift, and patient care became the center stage. But somewhere, cyber attacks and cyber criminals were also becoming more and more intelligent. But healthcare is slowly catching up with them, but then we are not at the same pace as the cyber criminals. Lack of awareness, because healthcare, the prima importance for us is patient safety. For us, it's providing the care at the right time is important. For us, innovation to give the right kind of solutions to be able to get the health of the person right at the right time is much more important. Cyber hygiene is somewhere left behind. Now, sometimes what happens is with all these importances that we have as medical device manufacturer organization, compliances like cyber security becomes a checklist sometimes. And cyber security is again a cash burning machine if it's not done right. You can overdo stuff. You can go ahead and do things which are not needed. So what happens is people start treating it as a cash burning machine, and that's where the problem starts. So I'll tell you a small incident. There was a large healthcare insurance organization by name Anthem Insurance Company in US. In 2015, they were breached, and a staggering 78.8 billion medical records were available in the dark web. Huge demotivation for the organization, huge face-saving problem for them. And after that, they had to spend almost 260 million year on year to get the right security controls in place, right security operation controls in place, get security audits done, and cover up all the things that were not right with them. So when an organization gets attacked, be it a medical device manufacturer or the caregiver or the healthcare provider, be it the hospital or whoever, the problem happens when they are attacked. It's not only a problem with how they are publicized on the media, the problem is they have to pay heavy penalties, the motivation factor of the employees comes down, the caregiver, the operations have a standstill, and because of that, the patient care gets a hit, and people are treated, the treatment is suspended for some time, things are taken back, and it takes time to again come back. On top of that, you keep spending money to get things in control. Again, the victim or the person whose data has been there on the dark web, he suffers mental agony. There could be financial frauds with him because his data is available. I would want to tell you one important thing. When your credit card data goes and gets breached, you can very well go ahead, block it, change it. But your medical data, it is your medical history, it's your demographic data, it's the data about you, your personal identity, which cannot be changed, it cannot be altered. So once it is breached, it is there in the dark web, and the cyber criminals can go ahead and exploit that for years to come. That's why cyber security in healthcare is far, far important. I just went ahead and did some search, and I came across this Safety Detectives, a site which is published, which actually publishes data through cybersecurity experts, privacy experts, researchers, technical product reviewers and all, and comes up with some data. I'll just show you the data. Look at this. Most common types of data breaches, healthcare, 78.5%. And it is IT incidents. The incident that I was talking about in the Anthem Healthcare, do you know how it happened? One of their employee very unintentionally clicked on a phishing email, and the malware just went ahead and reached the end server, and that caused such a huge breach for them. And it is by far the biggest breach in healthcare data. you would all have heard about AIMS. AIMS also got compromised. GE Healthcare also had its devices in AIMS. But because of the strong security controls that we have, GE devices were safe. So I would want to give ourselves a quick round of applause for that. I think it was a great work that we did. So coming back to the stats, medical records, look at this. On the dark web, a medical record sells at $1,000 as compared to $250 for financial data and all. So see the motivation for a cyber criminal. He can make so much money. That's exactly why we are talking about healthcare. Change in average cost of data breach by industry. As to how we are changing, how things are moving. If you see healthcare, 9.4% jump as compared to 7.8% jump in research. Average cost of data breach worldwide by industry. Again, healthcare. It's the leading. That's exactly why we would want that awareness be spread across. We know the problems about it. We know what needs to be done. And that is why GE Healthcare has come up with this workshop so that we keep an interactive learning session with all of you. We learn, we kind of educate, and together we have a fun-filled activity here. And that's why we are going to run a CyberWise quizzer. My colleagues, Abul and Bhaskar will also join me in this. So here is a Slido link. You have a QR code. I would request you to quickly scan the QR code so that we can play a quick quiz. And it would be an interesting quiz. We have very good goodies to be provided to the winners. So all the best to all of you. I would request you to quickly do a scan so that you can all play. I'll quickly give you 1 minute so that you can all scan and be ready to get into the quiz.
Please go to slido.com and use this this code 2948300. Enter this code, please. Done?
Just give us a thumbs up once you're ready. Trust me, it will be a great learning session as well as too much fun for all of you.
They are back. Please show the thumbs up, please.
Just show us a thumbs up if you're ready. And to decide the winners, please do give the names so that we can give the goodies to the winners.
We have a lot of people already logged in. Okay, first question is coming in a while. We need 10 seconds, right? It's coming. Can you see this question on your console? Yeah. Please answer that, please.
Okay, so the first challenge is pull the plug. So what has happened is there's a distributed denial of service attack that has happened. And you are the person responsible to prevent that. You must swiftly act on the distributed denial of service attack before it crashes the entire network of the hospital. What would you do if this was a ping from multiple sources? So will you unplug the device right away, the one, disable the ICMP, the switch, block all the IP addresses, or you will isolate the entire network from the internet? Please select your options quickly.
We got 50 answers already. We have 10 more seconds, please. 51, 52, 53, 55. The voting closes in 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. The correct answer is disable ICMP. 17% got corrected.
So the reason I think you have selected isolate the entire network is kind of a right answer, okay? But in a hospital network, that's not a feasible answer, because if you, let's say, disable the entire or the isolate the entire network, and let's assume there are some kind of surgeries being going on remotely, or some of the doctors doing those remote procedures, those can be hampered. So that cannot be an ideal solution. The ideal solution would be the disable ICMP, because if you read the question, the kind of DOS attack which is happening is via the ping, and ping uses the ICMP protocol. So the correct answer, or the most feasible answer for the scenario, would be disable the ICMP protocol itself.
Okay, we'll be moving to the next question. Now, this one is important. You've been attacked by a ransomware attack. You will have to pay, and this is what you're getting. That the radiologist goes and opens a file downloaded from internet, and the network just got infected with a ransomware. And now, what would you do in this case? Your options are, you will start scanning the entire network. Because it's a ransomware, you'll just go ahead and pay and recover your files. You will disconnect the infected system, or you will isolate the entire network from internet. What would you do?
Yeah, voting started.
We'll wait for 56 participants to just select their options. Ransomware, the most popular cyber attack that most of the healthcare organizations, the hospitals, the caregivers are being subjected to across the globe. So ransomware is about, you just get a denial of service. The system just stops working. And the criminal or the attacker just tells you, I need this much money. Either you pay through bitcoins, do something, but once you give, only then is when you will get to use the system. That's what ransomware is.
Yeah, one more participant. 55 is already voted. 56. Okay, 5, 4, 3, 2, 1. And voting closes.
And the right answer is disconnect only the infected system.
50%
And 50% of the people gave the right answer. Great. We'll go to the next question quickly. Look at this image. Look at the website. Do you see any problem? Or do you think everything is good? Will you go ahead and click it? Yes, I will click it. No, I won't. Maybe. It looks apple.com. It's correct. I use it. So you will be seeing, right, 35 people have answered. Yes, no, maybe. I don't see any problem with that website. Yes, I do, I won't.
And the voting closes in 5 seconds. 5, 4, 3, 2, 1. %63%.
Yeah, I think most of you have answered it correctly. The answer is yes. But let's talk about why it's a. So in generic term, how do you identify a phishing website? So we basically see, is there any padlock? We see here, there's a padlock. We also see, is it correctly spelled or is there any misspell in the domain name? But here we see it's correctly written, awplle.com. But still, as you answered, that this is a phishing page or there is a problem, and this is the real problem with this domain. So what happens is, this looks like an apple.com, but in the background it's not an apple.com site. It's some kind of attack where we call it as a IDN homographic attack, where what happens is, let's say we have an alphabet A, okay, in English, but in Spanish that could be a different, probably the size of the alphabet a little bit smaller, or sometimes we have seen that in some of the alphabet there will be some kind of dot on top of it. So we call it as a Cyrillic form of A. So Apple uses the A, but the domain whatever we have showed there, it was not an actual A which Apple uses, but it was a Cyrillic form of the Apple A. And that's where the domain was a phishing page. So this is the actual domain, which what happens is when you type in the browser, that looks like Apple, but in the background, the actual domain is something like xn-@abc, something like that. And the mitigation, how do we make ourselves aware of that we do not click on those websites, or how do we save ourselves? This is a kind of a vulnerability which is in web browser. Nowadays, all of the latest browsers have patched this vulnerability. So by default, we are safe. If you're using any older browser which is not patched, probably you could be one of the victims for those attacks. So just patch your website browsers just to make sure that you are safe from this kind of attack.
Very, very important thing in cybersecurity. Always take the updates that are being sent. Do not delay the updates, because they are security updates. Patching is very, very important. And coming back to medical domain, we also work we keep a very close watch on our devices and the software that's running on the ground. And we prepare the patches as and when we get to know about a cybersecurity vulnerability getting introduced. Moving on to the next question very quickly. All right, the question is, a medical device manufacturer accidentally releases a software update for the patient monitoring device that contains a bug. Now, the bug causes patient data to be transmitted to an unauthorized third-party server without the patient's consent. So what do you think? Is this a violation by the medical device manufacturer? There are laws by name HIPAA, there is the new law, the Digital Personal Data Protection Bill, or Digital Personal Data Protection Act. Do you think it's a violation of the laws of the land by the medical device manufacturer? Yes, it's a HIPAA violation. This is a HIPAA violation by the healthcare provider, not the device manufacturer. This is a HIPAA violation by both of them. and oh, I do not know. I need more information to understand who exactly is wrong here. So the idea is whom should we blame? Or we cannot blame anyone. Cyber attacks do happen. Is it the device manufacturer? Is it the hospital that's using the devices? Or I don't think there's anything wrong, or I need more information to judge.
Okay, we need 10 more answers. Three more answers, please. 57 is done already. 58. 59. Okay, 5, 4, 3, 2, 1. And the answer is we need more info here.
Okay. So most of you have answered the first one, which is this is the HIPAA violation by both MDM and the health provider. That's not the right answer. The right answer would be need more information, because in the question it's not clear. It's not clear that the manufacturer was the manufacturer involved in processing the healthcare data or not, because that is more important. See, the healthcare organizations, yes, definitely they would be responsible for the HIPAA violations, but here the question comes, is MDM also responsible for the violation or not? And the answer relies on if the healthcare also processes the data or helps the organization processing the healthcare data, then yes, both of them would be responsible for it. If not, then only the healthcare provider would be responsible for the HIPAA violations. In the question, since it was not clear that MDM is also managing that patient data or not, that's why the correct answer would be need more info.
So this calls for a need that there has to be a layered defense. It cannot be that one person has to just be sure of everything. Layered defense is one of the most important factors in cybersecurity. You cannot just rely on one security control. It has to be multi-layered. And that is why even if the medical device manufacturer has missed it, the hospital should have caught it. And because the medical device manufacturer is not processing the patient data, he doesn't have an information. And that's why you need all that information to actually decide whether he has to be blamed or not. Leaving aside the question, the important point that I want all of you to drive is cybersecurity is always about layered defense mechanism. Like an onion, you need to have multiple controls. You cannot rely on any one control. Quickly moving on to the next question. A hospital staff member receives an email requesting confidential patient information. What type of cyber threat is this likely to be? Is it a virus? Is it a firewall breach? Is it a phishing attempt? Or is this the ransomware attack that we are talking about? Very easy. Someone received an email in the hospital. He is the employee of that hospital. And he's being asked about confidential patient information. Is it a phishing attack? Is it a ransomware attack? Is it a breach of the firewall in the hospital? Or is it a virus? Is his system also infected? What's the right answer?
We need 12 more answers. 11, 8, 7.
We are also We can also look at the timing. So the goodies would be provided based on right answers, as well as the faster you kind of select the answers.
4, 3, 2 more answers, please. Yeah.
Phishing attempt. You can receive the email, but it's a phishing attempt. It's a phishing attack. Moving on quickly to the next question. Very, very easy. What is the abbreviate DPA stand for? What does this DPA stand for? All over the news.
Yeah, this should be easy for everyone. This is all over in the news. Recently become an act.
Recent memory of the brain. DPA.
Three more answers we need.
And the right answer is right. Digital Personal Data Protection Act, our own Privacy Act, which all of us were waiting for a long, long time. Moving on quickly to the next question. What is the primary purpose of a digital signature in the context of cybersecurity? All of you would have seen this. Some of you would have used this. Recently, all of us filed our tax returns and we would have done the digital signature there. What is the context? Why are we doing it? Is it because we want to ensure the integrity of the data? Integrity, by integrity I mean that the data is right, it is not modified. Is it because I want to prevent unauthorized access to the data? Is it because I want to ensure the confidentiality of the sensitive data that I have in that? Or I just want to authenticate the origin of the data? I just want to authenticate from where the data has come. What do you think? Why do we need the digital signatures in the context of cybersecurity? Last 2 seconds. Digital signature in the context of cybersecurity.
3, 2, 1.
And the right answer is?
Yeah, that's correct. So authenticity, the origin of the data, is the correct answer. Also, whoever have selected ensuring the integrity of the data, that is also a correct answer. So both of the answers are correct, which is around top 2.
Moving on quickly to the next question. What is a data controller or data fiduciary? We are hearing a lot about this, at least now when we were talking about the Digital Personal Data Protection Act. So what is the role of data controller or data fiduciary that we are talking about? Is it the entity that determines the means and purpose of data processing? Is this the entity that processes the personal data? Is it the entity that collects the personal data, or is it the entity that processes data on behalf of any other entity? What is a data fiduciary or data controller? Two more seconds. All right, and the right answer is, it's the entity that determines the means and the purpose. Purpose is very important, and the purpose is, why the purpose is important is, you take the consent from the person whom you are collecting the data by stating the purpose. Without the purpose, you cannot collect the consent. And then you decide, or the data fiduciary decides, what is the means with which I will be processing, and from there he will be giving it to any data processor after doing the due diligence, due checks. All right, moving on to the next question. Which provision of the IT Act deals with the punishment for cyber terrorism? Just wanted to remind, this still remains. The Digital Personal Data Protection Act has not replaced this part of the IT Act for cyber terrorism. Using cyber security and software and technology for terrorism activities. Is it section 66A, 66F, 67A, 69A? Which is the act? All right, the last 1 second. All right, the answer is 66F. The last question. The easiest one. What is PHI in the context of healthcare cyber security? What is PHI? Is it public health insurance? Is this protected health information? Is it personal health information, or is it protected hospital infrastructure? What is PHI? In the context of healthcare cybersecurity. The easiest question.
Okay, 5 more minutes. 5 more seconds, sorry. 5, 4, 3, 2, 1.
And the right answer is protected health information. Give a huge round of applause to all of you for being such a sport, for participating, for learning. And while Abul and Bhaskar go ahead and figure out the winners, I will quickly walk you through what we do at GE Healthcare in our day in and day out life to make our devices secure and safe. All right. So now I'll quickly talk about what we do at GE Healthcare in terms of our cybersecurity offerings and what exactly are we doing and why we think we are on the right track. Any medical device manufacturer, what is important for us? Number one, the most important, patient safety. Because we work on devices, the patient, a sick patient, or a patient who is worried that am I sick, the idea is to provide safety to him, to not increase the agony of the patient by unnecessarily making an unsafe device. So for us, the priority number one is always patient safety, but not anything less, the privacy of the patient information and the security, maintaining confidentiality, integrity and availability of the data whenever it is needed is far, far important. And these three are the pillars of our day in, day out work at GE Healthcare. Product security focus areas. So we do not, as I said earlier when we were discussing the questions, that security always has to be layered, defense in depth. So to start with, we do a secure design. The moment the product is conceived, the design is put in place, all the security controls that need to be there are thought through. After that, it comes to the implementation phase. Again, coding in the secure manner, having the right reviews in place, doing the right triaging is part of our development. And then comes a secure life cycle. By life cycle, what we mean is we are not concerned about cybersecurity only while we are developing it at our facility. We are concerned from day one when we have conceived the design to the day we are saying that we are not going to maintain this device anymore. So what we do is during the development, during the installation at the customer premise and the maintenance, all through its life, we keep a tab on the vulnerabilities that are getting introduced. We do a risk assessment for all those vulnerabilities periodically, and if any vulnerability can cause any significant damage, we go ahead, talk to the customer, provide the patches on time. So it's risk-based secure design. All third-party software that we use and the OS, we ensure that we provide the right support. We plan the entire life cycle of our product. We communicate the risk to the customers. There is an active engagement that GE Healthcare has with its customers. Secure development, secure deployment, entire life cycle management and vulnerability management while the devices is on the customer premise are the key elements of our entire lifecycle management of the product. Post-market, once the device is there at the hospital, we are not going to wash off our hands. We ensure that there is an intake, there is a continuous monitoring of what's going on with the software. There is a continuous monitoring of the vulnerabilities that are getting introduced, and we do regular scanning and testing back in our labs. We have a secured cybersecurity lab which is IEC 62443 certified for our security testing, and it is, I'm very proud to say that it is there in India for the entire globe of GE Healthcare, and I lead that lab. And we do this testing, we ensure that the right communication goes back to the customer and the right patches are provided at the right time. Assessment, again, risk impact assessment. Not every vulnerability needs a patch. So that risk assessment is a continuous process with us. And communicate, talk to the customer, tell him the impact, and provide the patch, deploy it, and manage it on time. So there is a journey that all of us are walking or taking in this cybersecurity entire thing that is evolving each day. We are there where we monitor, we provide the patches, we are there. We have a roadmap that is already planned. Our next term is go ahead and design all our products with zero trust architecture so that it is much more safer, much more secure. Remotely deliver the patches, be able to additional controls for future readiness. So, and we want to keep up the pace with which the cyber criminals are developing. Midterm and long-term plans, the idea is that our products should be secure by design, and we have a mechanism to come back fast even if an adversary happens. All our GE Healthcare customers get an access to our GE Healthcare product security customer portal. This portal is accessible to all our customers where they can see what all attacks have happened, if at all, what are the patches available, where can they download it, what are the mitigations that we are providing them, and all of that. So GE Healthcare ensures that we do a continuous communication, we have a relationship with our customer in terms of cybersecurity, so that together with the customer, we ensure safety and security and privacy for our patients. Thank you so much for hearing me out peacefully, hearing me out so much nicely. Now I'll call, you have heard how a global organization like GE Healthcare is working in the domain of cybersecurity. We'll now hear from Mr. Dhruv. He is the youngest cybersecurity entrepreneur and founder of Heritage Cyber World. He will walk us through what a budding startup in healthcare industry is doing with respect to cybersecurity. Meanwhile, we are working on the winners for the goodies, and we'll announce the names within next 10-15 minutes. Thank you.
Namaste, good evening, good morning. I hope my that voice is audible to the each and every the corners who are sitting over there. So basically we are over here to discuss the cyber security, cyber crime, cyber attacks. Every time we are always telling to each another that if we live fit, we can have a good wealth, and with the good health, we can have a good wealth. But if I can say that if our health data is not secure, then even though we can not have a good wealth also. All the data which has been covered up in this medical devices that are been leaked on the each and every e-marketplaces and the platforms which has been doing the trading of the data. before discussing that, before going towards the cyber security or some technical discussion regarding the medical devices, I will like to ask that why cyber security is important. Any one of you from the audience, why cyber security is important? It's not something that cyber security has been discussed in the discussion from the post-COVID only, but why cyber security is important? Can anyone tell me over here that when the first virus attack has been happened in this world? In which year? In 1992, the first virus attack has been happened in the world, and the first virus in this world has been created in the 1971. It is the period from where we are seeing that why the cyber security has been coming in the trends with the latest technologies. Slowly, gradually, we are becoming a digitalized. We are using the internet for our business, for our health, for our wealth, and wherever the internet is connected, whenever the internet is being used, we are always talking about the data, and whenever the data is being concerned, we need a cyber security. Recently, in this monsoon Lok Sabha Parliament, the Indian government has come up with the digital protection bill. As you know that since from the last many years, the Indian government has been active with the cyber security mission. The particular division in the Indian government is looking forward for the cyber security rules, regulations and the norms for the each and every sectors, where healthcare sectors plays the very major role. It's not about just only the cyber attack on the electronic devices which is being used to store the data or to do the businesses. It's also about the devices which has been used by the humans for the healthcare. The very small device, if we talk about, that are the smart watches, mobile phones and the Fitbits what we wear in our hands. There is not something which will store the health data. These gadgets, these healthcare devices are the spy gadgets for the particular manufacturers who are building these particular devices. In this last few years, we have been seeing that we are boycotting the Chinese products in India. But before that, many Chinese products and the many Chinese healthcare devices has been used in India, and it has been deployed to the patients and the particular humans. Today in India, in very vast thing, we are seeing that in number of black markets also the wearable devices what we are using, like before the recent years, if we want to go to the gym or to the fitness, we have our toolkit in our hand, that we will have our sports shoes, track pants, protein shakes and the water bottles. But there is the trend that if we want to go to the gym, we need to have the Fitband in our hand. Other wearable devices which can store the data. These same wearable devices will be the spy gadget for the particular manufacturer who has made these devices. Because the device which can stores the data, the device which can senses the particular motions in the body, that same device can store each and every surroundings what you are having in your environment. It means like a sound, like if some smartwatch or some mobile phone which has been used over here for the as an healthcare device, that device if that device got hacked, and if that same device can store the sound and particular vision over here, that things, your own privacy can be leaked up. It's not about just the data. It's one level ahead about the data. It's about each and everything, the privacy what we have. The pacemakers which has been used for the particular at the time of heart surgeries, the pacemakers can be get hacked easily. Each and every medical devices has the software, firmware, that devices can be connected to the Wi-Fi, internet, Bluetooth or the radio frequencies. This all things can be get hacked easily. And there are the many case studies which has been happening in this world, which cannot been listed out in the newspapers or the media releases, but yes, this is the fact that the pacemakers, neurostimulators, insulin pumps, this all are getting hacked and they need to be tested regularly basis. As Shivani ma'am has been saying that all the medical devices need to be tested. It's a mandate that if you are following a HIPAA compliance, it doesn't mean that HIPAA compliance will give you the checklist of securing the data. It's about that how much secure the device is, how much secure the data which has been transmitting in that devices with the help of that devices, that is secured or not. If we talk, I will like to ask one question also, that how many of you are interested in the stock broking over here? Just raise the hands. How many of you are interested in the stock broking? Who loves to read these share prices, that what are going ups and downs? There is a one country in the world who plays the gambling and the stock broking on the medical data, who stores the data of each and every person so in the world, and they play the gambling, that by seeing the health data they can do the prediction and the analysis that what the situation will be of the person, and they will play the gambling on the death of the particular human person. So our data is not just for a sell, our data can be also used for the gambling. So it's about the concerning that whenever we use any devices for the particularly healthcare, we should see that the devices has been made properly from the a particular, the OEM should be a certified and the trusted OEM. Parallelly with that, if so every data which has been stored in these medical devices, that needs to be verified and tested, that if this data has been stored, then where this data is going to be stored, in which servers this data has been going to stored. If the data has been going to stored on some cloud hosted a server, then that server should be in the India region, because you should know that where your data is moving on. If there are the two datas which plays the very major role, which is a PII and PHI. Everyone knows that any cybercrime which is going on currently with any individual person or the organization, there are only the two motives: to steal the data or to give the financial loss to the particular individual person or the organization. So if your health data has been gone to the hackers, it doesn't mean that patient data is doesn't something important data, but yes, it's an important data for the hackers. Because when ma'am was talking about the dark web, I will like to take you a little bit journey about the dark web, that what is the dark web. If you have seen in the films and the movies and the OTT series, each and every, even we read in the newspaper, that number of data has been breached, has been leaked and has been hosted to the dark web forum. But what does the dark web forum do? They don't just sell and buy the data on the dark web. On the dark web, you can hire a hacker, you can hire a kidnapper, you can hire a murderer to do the particular criminal activities on the dark web. If the same health data has been leaked on the dark web, and these criminal groups who are doing the particular activities on the project basis on the dark web, they can easily do the attack on the any VIPs and any celebrities and any officials of this nation, because this health data will stores each and everything about your body. What type of food is suitable to you, what type of particular medicines are suitable to you, if the anti-medicine has been anytime given to you, or the any food which is being which can be harmful for your body, if that food has been served to you. So this type of activities can be very harmful for you. And the hackers who are using the dark web and who are storing the particular data, they will get the beneficiary fraud by just having this data. So it's my request that if we are using the particular healthcare devices, even the Fitbit bands what we are wearing, the smartwatches what we are wearing in our hand, the particular mobile phones what we are using for the health data, that should not be used until unless we are not secured, or if we are not sure that data is going to leak or not. We should do the regular audits of the medical devices which has been used by the hospitals and which has been manufactured by the OEMs in this India, because it's not just about the compliance check what we need to do, it's about the securing the nation and the securing the data of the individual person and the organization. All the audit reports should be done as per the norms which has been made under the Ministry of IT. Particular norms and the regulations has been made for the audits, and the particular numbers has been made that in which duration the audit should be done for the devices. If we talk about cyber security importance in the healthcare, you have seen that AIIMS has been impacted with under the cyber attack. So there are the major cyber attacks which can be done with the medical devices. The first attack which can be done very easily, it's a phishing and the malware. Any malware can be injected to the particular medical devices, and the session hijacking can be done with the medical devices which is storing and which is flowing with the live data and the live motions in your body. Just for an example, if you are wearing any smartwatch such as a Samsung, Apple, or any smartwatches of any brand, that smartwatch it's been connected with the internet, and you have been wearing that smartwatch on a regular basis. If that smartwatch got hacked, it doesn't mean that your data will go, your whole schedule of the day, whole body structure. If I have hacked, if hacker hacks the particular smartwatch, he can know that at what time you will have your dinner, your lunch, your breakfast, at what time you will have your medicines, each and everything. Because that same device will be the spyware device for the particular hacker to do the spy on you. So it's a combo of the spyware and the particular cyber attacks on the healthcare. Being a concern to the cyber security, being a youth to this nation, it's my humble request that each and every medical devices, each and softwares for the healthcare departments need to be tested first for a prototype version for a 6 months minimum, to see that how the data is flowing in it, where the data is storing, how the data has been leaked. Because any systems you use in this world, any systems which has been made for the prevention, that are temporary, that are not permanent. Each and every day we have a new vulnerabilities, we have a new bugs, we have a new cyber attacks which are going on and which are not been listed easily in the library, and there is not a something universal library or a universal database in this world which can do the data matching with that particular database, that yes, my system has been hacked or not. In India, every 14.7 seconds we have a ransomware attack with the power energy sector, healthcare sector, pharmaceuticals, and the particular manufacturing units which produce the electronic gadgets. This is the ratio which is going on after the post-COVID. We are being targeted on the top 5 countries in this world where we have a number of cyber attacks in this sector only. Because all the sectors stores the very, very, very confidential data of the nation. At last, I will like to talk about that being a director of the Heritage Cyber World, what the innovation we did and what particular services we are serving to our nation, in particular the healthcare sector. Heritage Cyber World is one part of a heritage group of companies in which we have built up the Gujarat's first private integrated cyber security command control center, which is named as the Drona. In this command control center, we do the number of services which help you to prevent from the cyber attacks and recover from the cyber attacks. We have made the Gujarat's first integrated cyber command control center, which consists of the digital forensic lab and a particular cyber security lab which do the testings and the recovery from the cyber attacks. Our reports are directly admissible to the Supreme Court of Law. Our lab has been recognized by the Government of India. We have the team of ex-law enforcement officers, scientific officers from the CFSL and the cybersecurity researchers who do the regularly threat research on the world, that when the data has been leaked and how the data has been leaked. What innovation we have did over here, using the 106 technologies, we have integrated the solution under the one roof in a one command center, and we have built up the live predictable system of the cyber attack, like a climate. What the climate department do? The climate department give the warnings before 1 week ago or the 2 days ago that will be the heavy monsoon or the winter or the summer fall heat will be there in this particular region. The same thing we do. If we just monitor the any network or the any logs of the system, we can alert you on the advanced level or a before time of the cyber attack. We will give you the time frame, that in this time frame the cyber attack will be going to happen in your organization if you don't confirm the particular checklist or you don't take the particular precaution systems in your organization. The hospitals, the companies which are using the medical devices, they should be always secured with the 360-degree layer, because you are using the internet, hardware, software, firmware, which all can get hacked easily. You will be thinking that standing over here and just talking about the hacking, it doesn't mean that systems cannot be get hacked, but it's my surety that if we do the just one practice over here or one drill practice over here, and if we check the mobile phones and the particular electronic gadgets which stores the data, then 95% people's mobile phones are under the cyber attack, because on the daily basis we use the WhatsApps, we use the mails, we use the multiple social media platforms which stores the data. In your background there are the number of activities which are going on. Many times if you see that the battery gets drawn up very fastly, it doesn't mean that your mobile phone is getting older or your mobile phone is getting weak or the number of some applications are getting very overloaded. It means that whenever you are not using the mobile phone, at that period someone else is using your mobile phone or your devices. And this is the fact. This is the particular practice what we did in our lab. We were having the walking round in our lab recently 1 month ago, and we got the more than 2000 walking persons over our lab, and we just tested for our ratio, and the ratio comes up about that the 92% devices are always under the cyber attack and the people have not been alerted anytime. Parallelly, all the precautions I will also suggest to take a cyber insurance in this current period. Cyber insurance is the very, very concern point with the cyber security, because day by day the cyber crimes, cyber attacks are increasing. The precautions from the government side is being going on, but to secure yourself, the particularly financial loss and the brand reputation loss, to recover that you should have the cyber insurance in your organization as an individual person and the particular whole organization. Before signing off, I will like to request the crew to run one video. We like to show you that what vision we are having for the India, and to safeguard each and every sector's data, and what innovation we have generated in our particular integrated cybersecurity command control center.
In this modern, technologically advanced world, cybersecurity has become necessary for companies of all sizes, as their networks and computer systems possessing confidential and worthwhile data. Without a comprehensive cybersecurity strategy, your organization cannot guard itself against cybersecurity threats, leaving it vulnerable to cyber criminals. That's where Heritage Cyber World LLP comes in, India's leading cyber defense and digital forensic firm. But why do every business or organization needs cyber security services?
एक क्षेत्र ऐसा है जिसमें बहुत संभावनाएं पड़ी है, ऐसे मैं मानता हूं। मैं दुनिया के जितने राजनेताओं को प्रधानमंत्री बनने के बाद मिला हूं, शायद 50 से ज्यादा से मिला हूं, उसमें 25 से 30 राजनेताओं से मेरी जो बात हुई है वो साइबर सिक्योरिटी की उनकी चिंता। सारी दुनिया परेशान है साइबर सिक्योरिटी को लेकर। क्या मेरा हिंदुस्तान का नौजवान दुनिया को चैन की नींद सोने के लिए साइबर सिक्योरिटी के लिए फुल प्रूफ इनोवेशंस लेकर के आ सकता है क्या? बहुत बड़ा मार्केट होगा, आप लिख करके रखिए। सारी दुनिया की जो ताकत है उस ताकत को साइबर सेफ्टी की जरूरत खड़ी हुई है, साइबर सिक्योरिटी की जरूरत पड़ी है।
प्रधानमंत्री जी का विजन है कि प्रत्येक भारतीय को टेक्नोलॉजी से और इंटरनेट के माध्यम से अपने आप को सशक्त करना चाहिए। और डिजिटल इंडिया कार्यक्रम के वजह से एम्पावरमेंट भी हुआ है, सशक्तिकरण होने के साथ साथ सकारात्मक परिवर्तन भी हमारे जीवन के अंदर आया है। और आज अगर साइबर सुरक्षित भारत की कल्पना करें तो उसमें सबसे महत्वपूर्ण स्तंभ है जन जागरूकता। हमारे टेक्नोक्रेट कितनी भी सुरक्षा की सुविधाओं का अनुसंधान कर ले, कितने भी रास्ते ढूंढ ले, मगर लोगों में जागरूकता नहीं है तो जागरूकता के बगैर इसका उपयोग नहीं हो पाएगा।
To combat all these ever-revolving threats, Heritage Cyber World LLP comes with unique next-gen high-tech integrated cyber security command control center named as DRONA, which stands for Detection Response Organization Networks Analysis. Integrated Cyber Security Command Control Center helps detect and prevent malicious activity on the network and provide customer with early warning systems. This helps your organization with everything they need to stop breaches in one simple solution. Our services: Security Operations Center, Cyber Forensic, Dark Web Monitoring and Intelligence, Attack Surface Monitoring and Intelligence, Cyber Threat Monitoring and Intelligence, Live Surveillance System, Smart City Solutions, Techno-Legal Consultancy, Social Media Intelligence Service, Brand Monitoring, Company Executive Monitoring and Intelligence, Political Sentimental Emotions Analysis, Political Leaders Brand Monitoring. In this integrated cyber security command control center, we have fully advanced digital forensics tools and technologies set up, where we serve number of services such as mobile forensic, computer or laptop forensics, root cause analysis, malware analysis, ransomware forensics, email forensics, cloud forensics, employee notice period audits, surprise forensics audit raids, incident response, spyware analysis. Our Security Operations Center is a centralized facility that serves as the nerve center for managing and monitoring an organization's cyber security. It combines advanced technology, robust processes, and expert personnel to detect, analyze, and respond to security incidents in real time. Our Security Operations Center strengths are 24/7 monitoring, detection and prevention, 24/7 help desk, customer need-centric solutions, strong OEM partnership, dedicated partner account manager, experienced technical team for support, proactive monitoring and alerts, the most competitive pricing. Our comprehensive range of integrated cybersecurity command control center service helps you access and secure every aspect of your digital landscape, working closely with our team of specialized consultants, subject matter expert, and industrial leaders. We empower your teams to win their battle of preparing and responding to current and future cyber threats. Under compliance and regulatory advisory, you receive top-notch proactive and reactive cyber protections for all your digital assets. Heritage Cyber World LLP works on the vision of our Honorable Prime Minister of India, Shri Narendra Modi ji sir, to make our India cyber safe and generate employment on the cyber security domain to fight against ongoing cyber attack.
Before going, I will like to just say the two things, that the health sector is in desperate need of a cyber hygiene injection. Cyber security plays the integral part for the nation's security. This is all. I, Dhruv Pandit, signing off over here. Vande Mataram, Jai Hind.
Thank you so much, Dhruv ji. So, Amit Shah ji was talking about Jagrukta. So, I hope this session of ours has been able to bring that Jagrukta regarding cyber security among all of you. And while you leave this room, you have learned something and will be more aware while using the technology, while using the internet day in and day out. And again, like how Dhruv sir was talking about, it's very important that you engage with organizations who are ethical, you engage with organizations who know what they are doing. Not every medical device manufacturer is a spy. Okay? So now we'll talk about the winners of the CyberWise Quizzer. The first winner who took 301 seconds to answer all the questions combined is Kareem. Kareem, give a big round of applause for Kareem. Kareem, if you are anywhere, please do stand so that we will hand over the goodie to you. Or you can just come forward. Kareem, please give a big round of applause for Kareem. Okay. The next one is Vasu, P. Vasu. The third one is Sandeep Patel, Swati Agarwal, Rahul Agarwal, and Hina. Thank you so much for participating, and these 6 people will be getting some great goodies from our side. And thank you for being such a wonderful audience and hearing us out. We are reachable on LinkedIn, me, Abul, and Bhaskar. Please do reach out to us on LinkedIn or talk to the GE Healthcare team out here if you want to learn more, if you want to understand more about what we do at GE Healthcare to be able to secure our medical devices. Thanks a lot. Vande Mataram. Bye.
Thank you very much, Shivani, for that wonderful quiz, for sharing the knowledge, and also thank you, Mr. Dhruv Pandit, for sharing the immense knowledge with the crowd over here. I now request Mr. Saurabh Shekhawat, FICCI Delhi, to kindly hand over the memento as a token of gesture. Can we clap one more time for the knowledge shared by the experts over here? Thank you. Thank you, madam. Thank you, sir. You can step forward for a photograph, Shivani and Dhruv, along with Saurabh. We have a next open house with MedTech regulators and industry. The open house is on the medical devices sector in India. It is a sunrise sector that is growing at a fast pace. The market size of the medical devices sector in India is estimated to be $11 billion in 2020, and its share in the global medical device market is estimated to be 1.5%. The Government of India is taking significant steps to strengthen this sector, such as launch of National Medical Device Policy 2023, implementation of PLI scheme for medical devices, 100% FDI allowed in medical device sector, setting up of Medical Device Promotion Council and 4 medical device parks. It has been estimated that there are approximately 800 domestic medical devices manufacturers in the country. The medical device sector has proved its strength during the pandemic. The sector was able to meet the multi-fold demand for devices within a short period of time. However, to ensure sustainable growth in this sector, various key issues are required to be addressed. Historically, medical devices were left on the fringes of the Indian drug regulatory regime, with only a few devices notified and regulated as drugs under the Drugs and Cosmetics Act 1940. It was in 2017 that the first set of regulations centered around medical devices. The Medical Device Rules 2017 were issued under the Act. The MDR categorized medical devices in classes A to D in ascending order of risk and prescribed rules for their licensing, manufacture, import, product standards, etc., with varying levels of stringency based on such classification. In a major shift in policy, the Ministry of Health and Family Welfare notified a comprehensive definition of medical devices on February 11, 2020, and brought all medical devices within the scope of the Act and the MDR, labeling all medical devices as Drugs Commodities Act 1955. The sector, due to its complexities and diversities, is also majorly impacted by multiple quality control orders by MeitY and Ministry of Heavy Industry and compulsory registration schemes for accessories, components and spares being imported. This open house session will bring the MedTech regulators and the industry players together on a common platform, wherein the key gaps and challenges faced by the medical device manufacturers are to be discussed along with their potential solutions. The major issues faced by the medical device manufacturers in India are complex regulatory structure. Time period for registration of medical devices goes up to 6 months. Lack of robust domestic R&D ecosystem. Shortage of skilled human resource. Ineffective supplier ecosystem. Public procurement process. And non-acceptance of Indian standards in global market. We have the esteemed speakers with us today. We just wait for 2 minutes for the stage to get set, and a humble request to each one of you that post this session, we will have no tea break or lunch break. We will proceed. With him, the moderator will be Mr. Satyam Shivam Sundaram, Partner, Strategy and Transaction, EY LLP. Welcome. We have the MedTech regulators with us. Shri Kamlesh Pant, Chairman, National Pharmaceutical Pricing Authority. We welcome you, sir. Ms. Manju Sharma, Additional CEO, Government, E-Marketplace, GEM, Government of India. Welcome, ma'am. Dr. Manish Pandey, Director and Head, PAD, Division, Quality Council of India, Government of India. Shri Chandan Kumar, Deputy Director and Scientist C, Bureau of Indian Standards, Government of India. Shri Ashutosh Agarwal, Deputy Director, Legal Metrology, Department of Consumer Affairs. Also, we have joining with us Dr. H.G. Koshia, Commissioner, Food and Drug Control Administration, Government of Gujarat on the dais. We welcome you all. Thank you. And we have the invited state drug regulators, Shri Subramaniam Devtha, ADC, Directorate of Drugs Control, Government of West Bengal. Dr. Amal Kumar, Medical Device Officer, Drugs Control Administration, Bihar. Dr. Sudhir Kumar, Assistant Drug Controller, Drug Control Administration, Uttarakhand. Shri Basant Kumar Kaushik, State Licensing Authority, Chhattisgarh. Mr. Kuri Kiran Hazarika, Drugs Control Administration, Assam. Mr. P. Ramu, Assistant Director, Drugs Control Administration, Telangana. Mr. Shyam Sundar Pratapwar, FDA, Pune, Maharashtra. Mr. Shashi Mohan Gupta, Deputy Commissioner Drugs, Drugs Control Administration, Uttar Pradesh. And Mr. Sanjeev Kumar, Joint Commissioner Drugs, Food and Drugs Administration, Punjab. We welcome you all the dignitaries in the session over here. And now I request Mr. Satyam, the moderator, to take over the session further. Thank you.
Thank you. Dignitaries on the dais, dignitaries off the dais, participants from MedTech industry, international participants. Allow me to welcome you to this session. Thank you so much for being here this early morning. As you know, medical devices, particularly in India, is around 11 billion today as of certain estimates, and during the Amrit Kal period, we expect to reach to 50 billion. That's our target by 2047. And for this purpose, Government of India has been working continuously on various activities, including policy, including regulation, and various other activities which have been done. Some of the recent activities include launch of National Medical Devices Policy 2023, implementation of PLI scheme for medical devices, 100% FDI in medical devices sector, and setting up of Medical Devices Promotion Council, and also 4 medical devices park, which have been conceived as a part of this. While this sector is a sunrise sector, it's growing, there are also challenges that the sector is facing, and some of which include certain complexities in the regulatory system as it is evolving, the time period of registration of medical devices which has been experienced by the regulators, the challenges around the R&D ecosystem, and as well as the public procurement process. Now today in this session we have the esteemed panelists who would be talking about the regulatory aspects, who would be sharing their vision in terms of how the and we'll look forward to participants also adding to it. But before I invite the regulators and the panelists individually, may I invite Dr. Rajiv Raghuvanshi to share his opening remarks for the session. Dr. Rajiv Raghuvanshi.
Good morning. Working, no? Am I audible? Okay, yeah. So, good morning, and thanks for this opportunity. I think I wanted to start with complimenting Department of Pharmaceuticals and the team behind this whole show, which is being run for last 3 days. And beyond the very good organization, more important is it's actually showing convergence of multiple activities, which is so timely for this medical device industry that I don't think it could have been better than this. When I say convergence, you see, from regulatory point of view, the new regulation has come, which is in process. A part has been done, a part is left, which will be completed by 1st of October. If you come to policy, we recently released the medical device policy. There are PLIs going on. There is infrastructural development happening in terms of development of medical device parks. So everything happening parallelly actually shows the focus Government of India has on this sector, because we have seen the potential, and I think this is going to be another story, the way pharma developed in India. Now it's time for medical device industry to grow. If you see from a regulatory point of view, most of you know that the regulation, the medical device rule came in 2017, and since then, slowly and slowly, whole industry is getting regulated. Category A and B has already been brought into the purview of regulations. C and D is going to come from 1st October of this year. And after that, the whole medical device industry will be regulated. And one good thing is this regulatory regime should not be taken as some kind of constraint on the industry. This is actually a kind of facilitation for the whole industry to grow and reach to the target where all of us want. So we have created completely separate vertical to handle medical device. The manpower required to manage the medical device domain is dedicatedly be created with the kind of background and qualifications which is required to handle medical devices, which is completely different from drug side. The options and provisions of clinical investigation, performance evaluation have been bought in the system, so that the industry, entrepreneurs, whoever wants to understand how to develop a product which is acceptable globally, the framework has been decided. There are lots of people who are coming and discussing with us, because I see since it is a new regulation, a lot of people are coming. They do not have idea that they have a product, but how do we commercialize it in a regulatory regime. So we are consulting, we are advising them, and a lot of people have actually taken advantage from all this framework which has been created. And all this is happening because of one reason, that whatever we develop as an industry and the product coming out of the Indian medical device industry is meeting the expectation with respect to quality, which is the paramount if we have to survive, grow and become leader in a healthcare industry. Because in this industry, quality is the core of the every aspect. We cannot succeed in business unless until quality is at the core. And that is one thing. The learning from the drug side and pharma side is, if we can extend one thing, and that is the only one most important thing which everybody, regulator, manufacturer, consumer, everybody has to understand that. In terms to opportunity, if you see, as Satyamji just said, 11 billion is the current market size. The potential is immense. We are going to grow to 50 billion, and I don't think there may be some conflict on the date. Amrit Kal to 2047 reaching 50 billion is a very small target. I think it should be much more than that. What I think is by 2030 we should be around $50 billion. So the opportunity lying in front of us, for each one of you, it's a huge opportunity in terms of financial possibility also. The business is going to grow 5 times. And the potential, theoretically speaking, is everybody can grow 5 times from where they are today. And another very good aspect of this whole dynamics is that 80% today in terms of value is getting imported from outside. So all the Indian manufacturers have that opportunity to actually replace the import of 80% and make it indigenous and get that opportunity, business opportunity, convert it into a business opportunity. So the business opportunity is there, huge business opportunity is there, regulation has been bought, policies are being framed to support growth of this industry. At the end, only one point which I just wanted to bring as a caution, and this is also for every stakeholder in this industry, regulator, manufacturer, consumer, whosoever it is, policymakers, please do not offset your cost with quality. We have had these kind of experiences which were not very good in the drug side, where people have tried to offset their quality with cost to meet some cost target. If we have to take that learning from drug side and translate into the medical device side, this is one learning all of us have to very religiously take. Otherwise, our targets would get extended and we will not be able to reach where we want to be. So please have that focus on quality product, have that faith on regulation. Regulation is being bought to facilitate and not to strangulate the industry. With this opening remarks, I hand it over to Satyamji to take it forward. Thanks a lot.
Thank you, sir. It was quite encouraging to hear you, especially talking about the targets. And I'm sure innovation will play one of the big roles in ensuring that we achieve the target that you have put forward for the industry to look at. We are joined by Shri Kamlesh Kanji, Chairman NPPA. And let me ask the first question, which is emanating from the introductory remark, around the innovation. So what are the mechanisms for recognizing innovations and strengthening that you see would be taken, sir?
Yeah, good morning everybody. There is no doubt that we have to focus on innovation, promote innovation and lead on the path to innovation if medical devices industry, for that matter any sector of our economy, but particularly medical devices industry is to do well, is to scale up, is to grow to its desired potential that we are looking for it. Then research and innovation has to be promoted in this particular industry. Medical device industry, as you are aware, is slightly distinct from the pharma industry, the formulation industry in terms of its features, in terms of its special characteristics. In speaking in general, innovation is not exclusively confined to price related issues. To promote innovation, we must have a very broad-based, collaborative, multi-dimensional approach which will be required. Not only pricing will of course comprise one part of it, but at the same time things like industry academia interaction, research and development policies, investment in research and development, all those also comprise an important part of innovation and R&D success of the industry. As far as the pricing part is concerned, we have presently two broad mechanisms in the DPCO which allows us to reward people who are coming up with innovations. One is the multidisciplinary committee approach to pricing of many devices, where there are incremental innovations. The multidisciplinary committee in NPPA, they basically examine the data submitted, they examine the kind of innovations that had been carried out, and accordingly there is a differential approach based upon the kind of innovation, based upon the type of innovation, based upon the recognition of innovation given. The committee recommends incremental prices, incremental additional prices for these devices. In addition, for the original research and patented regime, patented areas, there is a para 32 of DPCO also, which recognizes broadly, I am speaking very broadly, but which recognizes the patents, which recognizes the research and development done in India, which recognizes the process also through which new innovations might being done. There is a provision that depending upon the patent, the use of those processes in product development and others, we can exempt the particular medical device or drug also, formulation also from DPCO, so that they are totally free to fix the price, to increase the price, and there is no, essentially there is no regulation on the price of that particular product in that case, if it is given an exemption under para 32. But para 32 exemption has to be sought. It is not self-invoked that this is patented or this is a patented process, etc. And it has to be sought and by the manufacturer, and NPPA examines the case and then decides upon whether para 32 applies to that particular case. But generally speaking, I am sure that much more work is also required in the area of say like things like academic interaction and between industry and academic institutions interaction, etc. Yesterday itself, I was talking to one of the leading manufacturers. I asked him that what prevents you from say interacting with, collaborating with, contracting out your things to academia in much more robust manner, with much more higher volumes. So one of the issues he raised was the confidentiality issues. He says that we spend so much amount on innovation. We are crores and crores of amount spent on particular innovations, particular discoveries, and if we contract out the work to academic institutions, that the kind of confidentiality issues arise from those interactions. That need lot of handling. We are not very sure that our, whether the particular those protection we will be getting in terms of our research will be becoming remaining confidential, etc. I'm just giving an example. I'm not kind of criticizing, but what I'm saying is making the larger point that there are many other issues also to research and innovation. Pricing is of course one important part of it, but these issues also have to be tackled simultaneously in addition to pricing, so that a robust and a very functional kind of R&D ecosystem comes up in the country. Thank you.
Thank you, sir. That was quite encouraging to hear you. The second very specific question around this that the industry has is related to the MRP requirements for B2B devices like capital equipments and bulk reagents in the IPDMS system. What do you think your opinion is on that, sir?
Yeah. This again is a very old demand of the industry. Old in the sense that not very old in that sense also, because many of the devices have come under regulation only relatively recently, and earlier there were not that many devices under regulation. As already we have spoken about that the medical devices is a very, very diverse kind of a sector. There are things like 2-3 rupees devices like needles and everything. Then there are devices that would cost say tens of thousands like stents and implants, etc. And there are this huge and very, very advanced and complex kind of devices like MRI, linear accelerators, etc. also that goes into crores of rupees. So there is a whole huge spectrum. Then there is another range in terms of some of the devices are B2B, which are sold to mainly to hospitals and institutions. Some of the devices are sold directly to consumers. Then there are devices that require special kind of servicing, which mostly go with service contracts. Then there are devices which also mostly go with software contracts. So all huge spectrum and huge range of devices is there, and this issue is relatively much more complex. In addition, the additional issue is many of the it is estimated that almost 80% of the medical devices are sold in a B2B setting. Although all those devices don't remain with the businesses as such. Many of the devices that are being sold in a B2B settings, for example, even needles or stents, ultimately land up with the consumers and they are billed to the consumers. So, so there is a very complex kind of a universe which needs to be addressed as far as this B2B exempting the MRP from B2B devices is concerned. But also there is no doubt that some of the huge devices that have that are not billed to the consumer, that have no direct kind of very difficult to relate their cost to the consumer, and those kind of devices, there is and also the information asymmetry is not there in case of those devices, because the hospitals and the institutions that are purchasing those devices are very well aware of the kind of prices involved, the kind of features involved. They are much more knowledgeable of these devices than many others. So in those contexts, there could be a genuine argument for exempting MRP requirements from these B2B devices. As I told that recently this medical devices policy has been promulgated, and a committee has also been set up to examine the pricing of medical devices. The committee is examining this particular issue. The government is cognizant of the demands of the industry, the issues of the industries with this particular demand, and I can assure you that a balanced, fair and reasonable kind of decision will be taken, which will be appropriate, which will be balanced in terms of both for the consumers also and both for the producers also. So I will confine right now to this extent. Thank you.
Thank you, Mr. Pan. This was really helpful. Let me move to Dr. Manish Pandey, because one of the things both of you talked about is around quality, around the level of defect that we have, and we today are joined by Dr. Manish Pandey, Director and Head PAD Division for QCI. So sir, the question to you is, what are the potential steps that Indian manufacturers should look at to ensure that they get global acceptance? And what kind of regulatory changes do you think that the MedTech sector needs to go through for this purpose?
Thank you. I hope I'm audible. Hello. Okay. So the question is about global acceptance. So I should introduce the organization that I work, which is the Quality Council of India. To our understanding, if I come directly to the point about global recognition, this only happens when you utilize a term that we call as quality infrastructure. While we understand and we have, the regulator himself here, we all understand that the regulatory frameworks are something which are focused to the boundaries of a country. But when you talk about global trade, then the term of accreditation and acceptance of something which is aligned to other countries' requirement is taken care of. Now with this, I would like to state that as Quality Council of India, we have come out with a scheme which is called the ICMET Plus, which is focused on product certification, which actually includes the elements of the ISO 13485 plus the requirements which our product should kind of show in terms of its efficacy and also in terms of patient safety. The point that I wanted to make here is that if the industry kind of thinks about or mulls about having such a kind of a scheme to which it gets itself certified, over a period of time, that particular scheme could be actually benchmarked with other requirements which are around globe, which could be a CE marking and others. And this could be done through the expertise within the Quality Council of India, where we have recently benchmarked some of the national schemes to the global schemes. So one is in the field of agriculture. And then the other point that I wanted to make, and also since the regulator is present, that there are systems where the regulator take cognizance of certain voluntary systems which are run through an accreditation framework, and they could take cognizance in terms of first comparing the requirements of the scheme to that what regulation says, and once they are satisfied, they can take cognizance of a certain part of compliance, thereby reducing the audit fatigue of the industry, and also from a regulator point of view to reduce their the resource load that they usually have to take when they have to ensure compliance before licensing. If this is done with the help of accreditation, I suppose the industry in the country could be accepted globally. The requirements could be harmonized in a manner that one certification could lead for better access to international markets. With this, I thank you.
Thank you so much, Dr. Manish. We are also joined by Shri Chandan Kumarji, Deputy Director in BIS. You heard Dr. Manish talk about the quality. Let me ask you the same question. As the Honorable Prime Minister talks about zero defect in the manufacturing, as BIS, what are your thoughts on ensuring products of global standards?
Thank you. Thank you, Satyam ji. And so regarding the how can we have a very good medtech industry that is globally a powerhouse. So I would like to say that to have a global medtech industry, high-class medtech industry, there is a need to adopt global good practices and world-class standards. So for that, at BIS, it is our role we have been given a mandate to create world-class standards, and for that, we are not only involved in the national standardization activity as envisioned in the National Medical Device Policy, but we are also very much involved in the international standardization activity. And through BIS, we offer a platform to all the stakeholders, including from the industry, academia. So through our technical committees, they can be associated with BIS and they can drive the discussions around standardization at the international forums. So we have led the discussions in standardization in some areas like contraceptives. We have led the discussions for past many decades, but for high-risk devices and then new areas, when we talk about artificial intelligence-enabled medical devices and then other such modern technologies. So there also we have a platform at the international forum. We have a voice at the international forum. I would like to say to all the stakeholders present here that when you talk about creating a world-class medtech industry, you should keep in mind that we must adopt the world-class standards, and then please support BIS in creating these standards, in driving the discussions around the standardization at the international forums. And this is the only way that we can adopt to achieve the goal that we have. And it is very heartening to see that all the discussions around medtech industry that we are having today. I would like to, many of the stakeholders are our committee members, and they have been supporting us in many of our technical committees, and I hope that they will continue to support. And through this, I think this will be a very key ingredient of this making a world-class medtech industry.
Thank you so much. Let me ask you a specific question that industry has around medical devices industry. That, you know, what are your thoughts around exempting them from the QCO quality control orders?
Okay, so regarding QCO, so I would like to inform everybody present here that you might have seen that there are so many QCOs being issued by BIS on products like toys and other such products, but on medical devices, we are currently not considering to issue any QCO because one thing that we must understand is that any QCO is only issued in consultation with the line ministry. So any QCO is only issued in consultation with the line ministry. So whenever we get such a proposal, there is a proposal to issue a QCO, then we consult, like in this case, we will be consulting CDSCO and then Department of Pharmaceuticals, and only then such QCO is issued. Currently, I think there are only two that we can call a QCO, that is on X-ray equipment, and that is as per a very old standard, which we are trying to remove, and mercury thermometers. So there also, I think, since the product is not much in use, but other than that, we do not have any QCOs for medical devices, and we are also not planning to have more QCOs in the current scenario. But whenever there is any such proposal, it will be duly discussed with the concerned line ministry and Department of Pharmaceutical as well as the regulator. Thank you.
Thank you so much for that clarification. Since we are talking about exemptions, let me turn to Shri Ashutosh Agrawal ji and request him to share his thoughts on exemption of medical devices labeling in line with exemption for the drugs. What are your thoughts on that?
Good morning to all. Am I audible? Thank you. I would like to ask one or two things from the audience. First of all, respected dignitaries on the dais and my dear friends of the dais. Whenever we are going to buy something, how many of us have faced a problem when we have been asked to pay more than MRP? Is there anybody who has paid or has been asked to pay? Because this is a very genuine problem which we used to receive regularly. And for this, there is a number 1915. If you feel any problem, you can call us at this number, consumer helpline number, and certainly we will take action if somewhere you are finding it is over and above MRP. Now, we talk about the legal methodology prospect. It is not only the labeling. Labeling is only required when we talk about the packaged commodity, or if we are selling products in the packaged form. Then only the labeling is required. Otherwise, legal methodology is concerned when the products are being sold in open. You will feel what are the requirements and why we are insisting to give the basic information of a product on this packaged commodity. This is nothing actually which we are asking and cannot be given. Internationally, India is an OIML member, International Organization of Legal Metrology member, and we have our rules as per the recommendations made by the committees of OIML. India is the member of all the committees in OIML, including ISOs. The legal metrology also plays its part in ISO committees wherever asked for. And these recommendations or the rules also require the quantity, net quantity. I think that all over the world, internationally, the quantity assurance can only be given by the legal metrology. So this is one aspect, whether it is in open sale, whether it is in packaged form, whether with the declarations or whether without declarations. All these things are different. But these are the basic requirements a consumer should know. This is the value for money. What the quantity I have been ensured, I have been asked or I am paying for, actually I am getting or not. Standing over here, I can give you the guarantee in the country, if you are buying a bottle of an oil or the liter or the water, anything, and if it is mentioning it is 1 liter, it is 1 liter. If it is 1 kg, it is 1 kg. This guarantee legal metrology ensures and provides to all 130 crores of the consumers of the country. As far as legal metrology is concerned, we being the concurrent subject, most of the enforcement work is done by the state governments. And legal metrology state governments, we at the central government level, we only have about not more than 3,000 people in the country who are looking after this legal metrology. And legal metrology is not only concerned with the medical devices, all commodities, all prepackaged commodities are covered under the legal metrology packaged commodities rules, whether it is drugs, whether it is not, whether it is cosmetics, whether it is medical device, whether it is food articles, anything which we talk are covered. And this is the guarantee which a consumer has that the quantity is correct, whatsoever the declarations I am getting, it is correct. So I hope that what we need, there should be, for the business, if I talk about the point of view of the community, there are two things. One is the one side says the Legal Metrology Act and the rules should be continued on the medical device, and the another side says that these are not required. Legal metrology should exempt the medical devices. I hope that they are talking about the packaged commodities or the declaration part. But from the beginning, when there was some request from the food department and FSSI came, what we did, we just made a provision of harmonization. So the most important thing is how we can harmonize the medical device rules and the legal metrology packaged commodities rules so that the industry can comply the provisions easily. That can be considered. This is one part. Secondly, if we talk about overcharging, if we talk about e-commerce sale, if we talk about to enter in the premises, whether it is a mall, whether it is a shop, because I hope that the drug officer may not be able or may not be entering in all the premises, which the legal metrology has the rights or the powers or the duties to enter and ensure not only the medical device but large number of other products which are sold in the country are complying the provisions of the law. So these are the few things which we basically consider in the interest of consumers. Also, if we see, if there is a problem, whenever we find any problem or the industry approaches us, last time I remember few days back that there was some problem in few states about the pricing, because NPPA and the medical devices or the medicals departments, DPCO has allowed to enhance the rates. But there was some problem in few states, and we took the immediately action and advice, issues and direction or the advisory to the state governments that whenever it has been decided by any of the government authority, you don't have to interfere. You have to honor it. So now there should not be any problem. Similarly, at the time of COVID, when there was requirement of ensuring the prices, I remember at that time even we asked to ensure the prices of the drugs when there was a problem with the COVID. So my request is we have to see a balance. It's a very thin line where we have to put our concentration how we can make a provision or how we can make an environment where the industry can grow, where the industry can be strengthened, but at the same time, the rights of a consumer, the rights of a common man can be ensured. Even after, I am ready, I am here only. If we want to discuss at any point of time, we have done many of the workshops, many of the meetings with the medical device industries. I remember 2 medical device industries meetings we have done within last 1 month. So we are open to discuss whenever there is any problem, to sort out the problem and to resolve it. Thank you very much. Thank you.
Thank you so much for that energetic response, and I'm sure the industry will benefit out of it. Let me turn to Ms. Manju Sharma, Additional CEO, GEM, who is here today. And ma'am, you play a big role in terms of connecting the manufacturers with the consumers through a process of this. So what are your thoughts on adding new categories of medical devices in GEM portal?
Can you just repeat this question?
What are your thoughts on inclusion of newer categories of medical devices in the GEM portal?
Yeah. Good afternoon to everybody. Actually, including medical devices on GEM portal or creating new categories on GEM portal is not an issue for us, but the problem is whenever, when there was, because GEM is basically a trust-based system. It was designed like that. So whatever the manufacturer, they are declaring whether they are registered with some authority or they are having some license with some authority, they are just declaring and we are assuming that it is correct. So that was the basis for trust-based system of GEM. So, when till the time this Class A, Class B devices were not under mandatory regulatory licensing scheme, we have seen that some people are misusing, some people are just declaring wrongly, but the pricing is also very critical, and some are quoting very high price for the same product, some very low price, so it becomes difficult for the buyer also to check the authenticity. So now after this regulatory mandatory scheme, we have now revising all the medical devices categories to comply with the current regulations, and we are making it mandatory, and we are just asking them to declare and to give the copy of the drug license, and based on the authorized drug license, we are giving them exemption from the vendor assessment process, because it takes a lot of time. And our QCI partner, they are doing the vendor assessment. They are exempting all the medical devices where the manufacturer is producing the valid drug license. Secondly, in fact, it is better for procurement agency also if there are standards for any medical devices. Like if in many cases wherever there are BIS standards, we are making it optional right now, because it is not mandatory from BIS also. It should be mandatory for all the manufacturers to have the drug BIS license. So I think I would request from DCGI office that in phase-wise manner, if we can make it this QCO mandatory for medical devices, maybe in phase manner, not for all devices right now. But it gives confidence to the buyers also, and it gives confidence to the seller also. So make it, because whenever there are standards, at least they will have the license and the buyer will be able to check those license. And right now we are integrating with BIS also, partly it is already integrated for where the drug license is mandatory. And whenever some supplier is giving the license number and everything, it is checking from the BIS website itself whether they exist in this supplier is having BIS license, name, product name for which it is BIS is given. So it is already fetching all those details from the BIS site. So if it will be convenient if on similar lines our CDSCO portal or the online portal where all FDAs or state FDAs are integrated, so that license can be verified online from the portal itself, instead of because there are chances of counterfeit products or the forgeries. We are coming into many cases like this. So it will be good if we integrate most of the government portals so that it can be verified online instead of manual verification from everybody. And so basically GEM is the portal for procurement and facilitating buyers and sellers, and GEM is only implementing the government policies or rules and regulations, whatever applicable to government. So we are just implementing all the procedures and regulations, whatever is applicable. So the category creation is not an issue. We can create those categories, but it becomes very difficult for the buyers to decide if there is no standards, there is no certifications. So it will be better if we can move in that direction so that it will be convenient for the buyers and sellers both. It will ensure the quality also and pricing also, I think. Thank you.
Thank you so much. Since I've been talking about exemptions, let me ask one question around exemption to you as well before I move to the next speaker. In terms of PPO exemption, what are your quick thoughts on providing the same for newer categories or technologies of medical devices with new features?
Yeah, PP order, I think you are talking about the exemption list from the Make in India. So I think exemption is required only where there is no capacity in our country for manufacturing. But right now we are moving towards capacity building in our own country. And but at the same time, the medical devices are so critical. The requirement is by the buyers is very critical. So in any case, if we don't have the manufacturing capacity right now, we have to go for exemption list. But exemption list should be very specific, because I have seen the existing exemption list where the brand name is also mentioned. So I don't think you have to mention any brand name for the exemption of any Make in India category. You can specify the item or the category itself, but not the brand name. And secondly, it should be very categorically, we have to see whether any variant, similar variant is already available, and the additional features or something is actually really required for the basic requirement of the buyer. If it is with some variation, it is already available, so it should be dealt with on merit basis, not the blanket approval for exemption of the this PPO, this Make in India exemption. So that is my view. Thank you.
Sure, thank you ma'am for that elaborate answer. Let me now turn to Dr. S.G. Khoshiya, Commissioner FDCA, Government of Gujarat. Now Gujarat has developed an excellent manufacturing ecosystem for pharma sector and drugs. So, what is it that you have done, and what are your expectations from the industry? We talked about industry's expectations till now, so it will be good to hear from you what you expect from the industry as well.
Thank you, Chair, Moderator, and the panelists and the esteemed audience. As a Gujarat almost everybody is known about, because as a Gujarat, we share almost 5% of India's population, 6% of India's geographical area. But if you look to the pharma and medtech device output, I think it's one of the leading state in pharmaceuticals. Almost India's 1/3 pharmaceutical production happening in Gujarat. Almost 28% of pharma export is happening through Gujarat and Gujarat-based companies. And in medical devices, if we especially speak to the implantable devices like cardiac stent, orthopedic implants, and integral vaccines, yes, we are one of the leading state. And I have been associated with this department since last more than 3 decades. If we look to the Drug and Cosmetic Act, the Act was not more focusing on the device since inception. There were only 2 devices, this IVD and the mechanical contraceptive. They were regulated in the Drug and Cosmetic Act 1940. Later on, in 1996, there were 4 devices added like IV set, BT set, disposable needle, and syringes. And in those times, these industries were in Gujarat like cottage industries. And there was a lot of hue and cry because industry people said, if we want to comply, have a license, we need to invest a lot of money. But as FDA, we did handholding to them. We issued them license. They come out with the best quality. And I'm happy to share with you that now all the small cottage industries and small SME industries, they have C certification, and now they are exporter, and most of their IV set, BT set series, they're exporting the European Union with the C mark. So regulations are for the betterment of the society. We are the part of that society as a regulator, as an industry, as a citizen, or as a patient. So right now, thanks to DCI, because right now we are more focusing on the medical devices. We have a medical device rules 2017 in place. It is come in force from 1st January 2018, and a lot of unregulated devices are notified. It was voluntary registration. Now it has come to the mandatory registration from the 1st October 2023. So most of the industry people, there are also again the hue and cry how to get registration. So we did a lot of camps in the big cities of like Ahmedabad, Baroda, Surat, and Rajkot. And my team went to the stakeholder. We did a camp. We issued on the site registration. So in Gujarat, we have a proactive governance, proactive government, and we always support the good people. And of course, we are the hardcore regulator to the wrongdoer, those who are indulged in the spurious or default and defaulted devices. So this is the core, I think, strength of the state of Gujarat and its commitment of the government. And again, in medical device, especially in this implantable device, cardiac stent, yes, Gujarat and Gujarat-based industry has taken a lead in the India, and the first cardiac stent that come out from the state of Gujarat. And I'm happy to share that right now Gujarat is one of the leading state, super high-tech devices like cardiac stent manufacturing is concerned. And again, Government of India has also invested almost 42 segments as a thrust area, and medical device and pharma is one of it. And our Honorable Prime Minister is looking for, and is a dream for Make in India. And as a government, state government, we try to fulfill it through Make in Gujarat. And right now in Gujarat, almost 400 plus medical device industries are functional. It includes category A, B, C, and D. And as a regulator, of course, our expectation is safety of the patient, quality of the devices, and the genuine interest of the manufacturers. We always try to balance all those three areas, and we never compromise with the quality, we never compromise the patient safety, and we always listen and try to resolve the genuine interest of the manufacturer. Ultimately, any rules, regulations, or the act, it's for the betterment of the society, for it is for the, this is rightly mentioned in the opening remark, it is for the Bahujan Sukhai, Bahujan Hitai. Thanks all.
Thank you so much for that elaborate expectation that you have put forward. Let me now move quickly to state regulators. And considering the time that we have, may I request each of the regulators to take maybe 2 minutes to outline the key challenges that they are facing and what is their way forward that they think. And let me start with Shri Subramaniam, ADC, Directorate of Drug Control, Government of West Bengal. Okay, may I come to Dr. Amal, Drugs Controller Administration, Bihar.
Good afternoon, everyone. Respected dignitaries on the dais and of the dais. We have been at the regulation since 1st of January 2018 of the medical devices. Slowly we have faced a lot of problem. Current scenario already discussed. What major hurdles we are facing in the state regarding the testing of the samples? Sir, as recently the gadget notification has been done on the 2nd of June regarding the MDTO and the MDTL. So central laboratories are not accepting the samples were collected from the streets. So why like the MDO who are working all over the entire country, why not the same MDTO will be also be working for the entire country? That will be the one of the easiest process for the sample testing. Because what we have faced recently, as we know, the Bihar is a consuming state. We are very good in the procurement, and corporation, they are procuring the medical devices from the different state. Some impaneled lab, that is the NABL accredited lab, they have given the test report like that, not of standard quality. But again, for the legal sampling, we are facing these of the problems in case of the testing and also the quantity and the sampling quantity of this. This is the major hurdles. And hand holding we are doing, and with the effort of the state government and our department, we have developed the industries also. That is the good news for all the industry people. We have developed now the class B category of the 6 syringe needle factories are there. And recently one new gloves factory has been also introduced in the state of the Bihar. And one more concern regarding the reach to the consumer level. What I want to convey in this forum, especially for the industries, we have to have insight like who is the owner of this product. Like medical devices, the ownership should be belonging to the patient. Our insight should be like that the product is belong to the patient, not the ownership of the manufacturer or law. Why I'm saying this is the intended to use by them. So though we are with very stringent regulation, but looking at our objective of the Honorable Prime Minister, that considering the ease of doing this, we have to look at the benefits of the patient. I'm not taking the much more time. Thank you for giving me this opportunity. Thank you, everyone. Thank you.
Thank you so much, Dr. Amal. May I now turn to Dr. Sudhir from Uttarakhand to share his views in 2 minutes.
Good afternoon, sir. There is a big problem in our state is a manpower problem, na, sir? And also testing facilities are not for medical devices, and we are in developing phase, and we are developed all these things. Thank you.
Thank you, Dr. Sudhir. May I turn to Dr. Sri Basanji from State Licensing Authority, Chhattisgarh.
Good afternoon, everyone. Chhattisgarh is major consumer. Our government facilitates about the free diagnostic policy, but we have no any medical device industry. As regulators, we face the problem regarding the lack of HR, and the same that Ramal said, the testing laboratories. If we have the testing laboratory and the standardization processor, we will better regulate the policies. Thank you.
Thank you so much. May I turn to Mr. Kiran from Drug Control Administration, Assam.
Thank you, sir, for the question. As this medical device industry is rapidly growing, and as quoted by respected Raghuvanshi sir, that we are trying to reach 50 billion in 2030. At the same time, with the state drug regulators are facing several problems along with the time, because the thing is that along with the time, the different medical devices it's coming in the market, but the competent persons or technical persons in the state drug regulators, their expertise is not enough to judge all those things. So that means along with the time we need some specialized training program so that we can cooperate with the industry peoples, we can go with the standardization procedure so that it is a maintain the quality of that particular products. And in Assam also, we don't have that much of medical device parks. It's a new concept for us also. Then along with that, again mentioned by Amul sir and our Satisgar sir, that the testing of these different medical devices, it's quite difficult for us because there's not that much of facility in Assam also. So I request sir, so that it can be facilitated to our state government also. Thank you, sir.
Thank you so much. May I turn to Mr. P. Ramu from Telangana.
Sir, good afternoon everyone. Myself Ramu. In addition to the testing facilities, actually we need more training in this subject because we did pharmacy. Of course, we are learning while approving the application. We need training and we may expect some technical experts in our regulatory, so that it will be beneficial to both the regulatory as well as the patients. Thank you.
Thank you so much. May I request Mr. Shyam Sundar, FDA Maharashtra.
Good afternoon. I am representing Food and Drug Administration Maharashtra, and we have to make aware to the audience that prior to notification of medical device rules, in the year 2011 and 12, Maharashtra FDA carried out some studies horizontally and vertically also, that the devices being used in the hospitals, its landing cost or its manufacturing cost to the till it reaches to the patient. And at that time we submitted some proposals to CDSCO and to NPPA also to notify devices as drugs. That time some scheduled devices were also notified at that time as the drugs. Later on, when we were facing problem about this industry, like some of you may be aware that Mira Bhayandar area in Mumbai has much number of fabrication units. They used to manufacture orthopedic implants. For them it was a product. For us it was of very much importance since being to healthcare industry. And the battle went on to High Court of Mumbai. By the time, thankfully, MDR 2017 notified and all the matters disposed of by the High Court. Otherwise, we were fighting for 6 to 7 years to insist them to bring under licensing regime, and they were fighting that it is not a drug, we are not manufacturing for any particular patient, or we are not aware of the rule. So I thank central government that it has clarified the issue, and now all over the India we have a uniform code. About the problems being faced now are about technical expertise from regulatory side. We need more trainings. Of course, CDSCO has just now conducted 10th training program for state drug regulators, and it has cleared how the audit is to be carried out. There are some glitches in the law as well as in applying on Sugam portal. I think there is nobody from NIC or Sugam portal to address the issues here, but to make aware of other authorities. There is no provision to track the application once it is sent to notified body. The law mandates certain period for notified body to carry out audit and to submit report to the licensing authority. But since there is no time record between the application marked to notified body and when it comes to licensing authority has to grant the license within 20 days. But notified body can take up to 120 days, 90 days for inspection and 30 days for making its report. If we legally allow them 6 months period, how we expect industry to have cooperation from regulatory? People, I mean industry applies to state FDA or CDSCO, whatever the authority based on the category class of the device. I think this period of auditing by notified body and submitting its report shall be reduced to maximum up to 45 days, which is currently 120 days. So since there is hue and cry about the delay of licensing, delay of granting certificates, we have not noticed this legal provision which is given liberty to notified body. So my request to DCGI sir and all other authorities that if it is possible, can we make some amendment in MDR to grant for notified body to give its report within 45 days so that we can expedite the application and we will help the industry. There are certain other glitches in Sugam portal also, like manufacturer has to submit every document, whether it is related to his device or not. There is a heading and he has to at least write a not applicable on a paper, scan it and upload. So this is some cumbersome job. Whichever, there shall be a provision to upload relevant documents. We cannot make mandatory for them to apply for 30 or 40 documents, out of which 20 are not applicable to them. And he has to write not applicable as on a plain paper, scan it and upload. Otherwise, the application cannot be processed. So these are the glitches for Sugam portal, and I think all state authorities will agree with me that even though we have a wish to help industry and expedite their applications as fast as possible, it is sent to notified body which is not under our control. So maybe the central authorities can make a note of it.
Thank you, sir. May I request Mr. Shashi Mohan from DCA Uttar Pradesh to make his remarks.
Hello, respected DGI sir and dignitaries on dashboard. My suggestion is that role of notified body should be removed from the system because it delays the application and it increases the cost of license. It is entirely against the policy of ease of doing business by central and our state. My suggestion is also that all units of new license application, including MD, should be jointly inspected by state and CDSU regulators, and periodical regulatory inspection should be performed by state inspector also. Thank you.
Thank you so much. May I request Mr. Sanjeev from Punjab to make his quick remarks.
Good afternoon, sir. So today, lot many speakers and scholars have already spoken in the issues, and we are thankful to the CDSCO that they are arranging the training programs for the drugs state regulators. Recently, from 7th to 11th August, training program for the state regulators was arranged. Similarly, online meeting with the state regulators was arranged on 12th July to address the issues which are concerning the states. So similarly, I would request that training for the stakeholders should be arranged. As yesterday Dr. Jitendra Sharma said that it's time not to compete, but it's time to collaborate. So if the state regulators, CDSCO and stakeholders, we collaborate with each other, so the issues of the industry can be addressed very well. Second, the MD online portal should be made user-friendly. On that portal, the various rules, notifications, or other etc. should be uploaded so that the stakeholders can take their advantage. Thank you so much for arranging such a beautiful India MedTech Expo 2023 and inviting the state regulators to this expo. Thank you so much.
Thank you so much for your remarks. Before I open it to the audience for their questions, we are fortunate to have Dr. Rajiv here. Sir, you have heard the state regulators and their remarks. Would you like to make comments on them?
Yeah, just couple of comments on this Maharashtra issue. So CDAC issue, we have a cognizance of what you are saying. We have to appreciate one thing, this whole medical device regulation is actually building as the regulation is getting implemented. It is not yet fully implemented. So need of the time is to actually have dialogue with us or CDAC and bring out all these issues which basically the customers and users are facing, so that some corrective action can be taken. So I'm happy that you raised these points. These points have also been raised by some other state regulators, and we are trying to see how do we resolve it. Resolving through CDAC is currently getting little troublesome, but we are trying to see what best can be done. So that is one part. And for these kind of issues, all of you must be knowing that we have initiated a monthly conversation with the state regulators. So religiously from this month onwards, before this we met all the state regulators face to face, zone wise, right? So we met Maharashtra also, we met everybody. And we have finished those 5 meetings. From this month on 29th of this month, notice has already been sent yesterday. We are meeting with all state regulators together in CDSCO, and every month we will meet, and the purpose is actually to bring out these issues which states are facing. So that is on one part. Just to answer Mr. Gupta from UP, I think I would little disagree with what you are saying, and reason is, rather than trying to get into everything, we should try to not get into everything and take us out from the regulatory system and put it more on the system and the private parties and just monitor. What I heard you saying that you should, these private accreditation bodies should not be there and only regulator should do the inspection. I think we have to come out of that mindset. The times have changed. So these 2 questions and 2 comments I wanted to make.
Thank you, sir, for that remark. May I now request, any questions from the audience? Please identify while asking the question, and please make it quick and sharp. Straight at the back, please, in the middle.
So, good afternoon, everyone. My question is to GEM, Madam Manju Sharma. Ma'am, there are a few tenders which are being floated as a customs bid now in GEM. So, as a request, if followed by a customs bid for all those tenders, if a category and specifications can be created just after the custom bid, which will help us in listing the products for all other prospective manufacturers who are there. I have one more question, is that for some existing categories, particularly in quadrant 3, specifications has been created quite old, and therefore the new manufacturers are facing difficulty in listing their products because the specifications are not wide enough. If any technical committee can be created for the existing categories to widen up the specifications, and this will help all other manufacturers to list the products. That's all. Thank you, ma'am.
Hello. So your answer to your first question, custom bid is created only when there is no category available on GEM portal. So we want the request from the buyer who is creating the bid to create the new categories for them, or any buyer or any association if they are requesting on behalf of their members. So we will create with all details of the item or the specifications or past bid, whatever. So we want all details from the buyers or from the industry associations to create the new categories, number one. Secondly, regarding the upgradation of the existing categories in quadrant 3. So right now, after this mandatory licensing for Class A, Class B, we are already in the process of revising all the categories and moving those categories from quadrant 3 to quadrant 2, where the manufacturer has to come first on the portal, then they can authorize their resellers and then come in board on portal. So right now we are already in the process of revisiting all the categories which are 4-5 years old. We have already done I think 300 categories. Now we are maybe moving towards 800 odd categories we are in the process. If you have a specific category issue, you can tell us, or you can email us for the specific category that we will do on the priority. That is. Thank you.
Good afternoon, sir. This is Sumati Randeo. First of all, I would like to congratulate and say a big thank you to the panelists here. They have worked with us, with the industry, and a journey that has been accomplished. We started with baby steps in 2006, and here we are now talking about going to the next level of the reforms. I also like to thank Sir Dr. Raghuvanshi in sharing with his perspective of regulator being not just the regulator but the facilitator in promoting the quality. So today I'm standing here as a citizen of India, and there's a request. Now this comes from a very recent experience, a personal experience. I belong to a very small city in Punjab, and my father was from past 1 month struggling to have a Class B device. And unfortunately, some of us who are from this, I would say, background, we understand that there is a need on the labels to have manufacturing license and import licenses. But there are so many devices yet in the country which are being sold without these two. And it is very difficult for us to establish whether they are, of the good quality, etc. So my request here is, and also to the ma'am, Secretary DOP sitting here, if we can have some news item in the newspapers which can increase the awareness that now these devices are regulated in the country, and something like, an advertisement which was done long time back by BIS Jago, Grahak Jago types, and giving the awareness to the common man that if they are going to buy a device, the manufacturing license, import licenses are mandated. That will solve some, awareness problem in that direction. I know industry is aware. I know as regulators we are aware, but sometimes, just to address the awareness to the next level, specifically for Class A and B products. So that's the request. Thank you.
Thank you, ma'am, for your request. I think it's noted by the authorities. Next question, please. Yeah, at the back.
First of all, thank you so much. This was a truly informative discussion. I have two questions. Number one being, how are we approaching reusability of medical devices, let's say Class 2 or Class 3 medical devices, which are perhaps to offset the cost of the device? Let's say if you talk about catheters, are being reprocessed within the same facility without the adequate quality checks. Are we working towards maybe developing standards or maybe developing policies to prevent that from happening? And number two, given that people from the industry possess a good amount of knowledge and understanding around, let's say, the quality elements, the regulatory elements, and at the same time the technical elements, do you see a possibility where industry can act as a knowledge base where it can collaborate with the government towards filling that knowledge gap that currently exists?
Yeah, so answering to your first question on use of refurbished devices. So this topic is under discussion for long. Recently, this was being actually driven by the Environment Ministry, especially for the imported refurbished devices. And they have given some notification recently, giving out the list of some equipments which are allowed for import. Having said that, that discussion is not yet over, because we still have to discuss that how do we manage the quality of refurbished device. And that needs a whole lot of boundaries around that. So that discussion is ongoing. On the second part, on the use of industry's knowledge, so there is no doubt about it, and it is in practice also. Every capacity building program which we currently do, 90% of the resource people we pick from industry. And that was also true when we recently did a capacity building program for our internal regulators from state and center on medical devices regulations. The resource persons were mainly from industry, because as a regulator we recognize that the latest and the I can say best knowledge, best contemporary knowledge actually lies with industry, and we are completely open to tap that resource and get that knowledge. So hope that answers your question.
Yeah. So my question is for GEM to Manju Sharma ma'am. Ma'am, we are stuck on vendor assessment panel. So now there are certain requirements which we are uploading, and many a times we are getting a query that 5 requirements are okay, for one you need to upload it again. When we upload that, the earlier approved ones got rejected and this one get approved. We are trying from several months now, not getting success.
Actually, vendor assessment in GEM is being done by QCI. And for medical devices, we have given clear direction that whoever is having the valid drug license, they may be exempted from the vendor assessment. So that part is okay. But I think they need some documents. I don't know exactly what are those documents. If you can specify, you can send me the mail. What are those documents? Maybe the financial document, they must be verifying something. I am not aware of those documents. If you can specify, you can send me the mail. What are those documents which are to be verified by QCI? I will just take up with the QCI. If possible, I am not aware of those documents. But for medical devices, vendor assessment process is exempted. So maybe some financial documents, some documents I am not aware. You just send me the list along with your category, your name and details.
Thanks a lot, ma'am. I'll do the needful. Thanks, Sue. Thank you very much.
Yeah, thank you.
Excuse me. Hello. Sir, medical devices industry that we understand, that is being regulated by multiple ministry, multiple departments. So we face a one most important challenge where the notifications are passed and then the implementation time is so less to actually for the industry to prepare, and sometimes we have faced that because of those challenges the shipments get stuck at the port. So we are not saying that we don't want to comply with the different department notifications or circulars. It is that industry should get enough time for preparedness and to have a kind of a, you can say, involvement in during the planning of such notification when we bring out such. Thank you so much.
So it would be good if you can give some example, because from government side we try to see that we get the feedback that and do an assessment that how much time is required for basically compliance. But if you can name some specific examples, we can certainly look into it.
E-waste registration requirement, when the portal was not ready and our shipments were stuck for last 13-15 days, and we really had to work with different departments to get our shipments cleared. Yeah. Thank you.
Thank you.
Good.
Hi. Hello. Hi, sir. Very good afternoon. Sir, my question is to DCGI, sir. Sir, as we have in pharmaceutical regime, we have a NOC provision to export NOC. Why, whether there is any kind of provisions is provided in medical devices also, so that it will be like more convenient for us to export business, bring in the export business to do a for the manufacturer, and as well as we don't have, if the manufacturer doesn't have a license to manufacture those devices, and he can, what do you call that, he can do only a export NOC, so it will be helpful for the manufacturers to bring the business to India.
Yes, right. So, just to answer your question, I think I would request my colleague, maybe Asim. Asim is sitting here somewhere. He is the Deputy Drug Controller in medical devices. He can tell you, because these are very micro level questions, I would not be able to answer that question.
Thank you, sir. Thank you for giving me opportunity, sir. To answer your questions, what I just suggest you, why you require export NOC? Because already you are having the manufacturing license for that particular medical devices.
Sir, we have a manufacturing license for the particular devices, but certain requirements are there, which is the specifications are not matching.
If you require a specific requirement in the country specific, so that we will provide you, and that in the MDR 2017 it is their provision for export purpose. If you require certain certificates, definitely we will issue that certificate. But request from your end that we need to receive that. Then only we'll see that. But if you require the specific certificate for export.
Only for export.
So then definitely we'll provide, and there is a provision, and we are also issuing case to case basis, not for the all cases.
This provision is in a hard copy.
Hard copy we will, till the provision in the online portal, will issue hard copy of the whatever the certificate you require for the purpose of export.
Thank you, sir. Thank you for the information. Thank you, sir.
Thank you, sir.
Thank you so much. Considering the time limit that we have, I think we'll have to. Okay, one last question. I can see one person standing there, so that's the last question we'll take.
Hello, sir. Sachin this side from Richard Wolf. Sir, my question is this, that biologicals department, there is a provision for filing post-approval changes annually. But in the medical devices sector, we do not have provision to file minor variations annually. We have to file in stipulated period of time. Do we have any plan, projection, or understanding in terms of filing minor post-approval changes annually instead of filing between 15 and 30 days? Thank you.
For minor and major post-approval changes, there is a post-approval changes provision on the medical device online portal, and immediately you have to intimate to the authority, whosoever is the licensing authority, for any such changes. Only thing ki for minor changes only notification is required, and for the major changes, major post-approval changes, you need to take the final approval from the licensing authority. So that provision clearly made on the medical device rule, and also the provision, online provision is there for notification as well as the approval for such changes. So I hope you now understand. You may be aware of that also.
Sir, actually my, thanks for the clarification, sir. My just concern was that we have to file a minor approval, minor changes, variations, immediately or after getting notified from the global. But
for minor changes, there is no specific approval is required, therefore no specific timeline for that. But the notification, you can notify that to the licensing authority, whether it is a central licensing authority or the state licensing authority.
Okay, sir. And second question is this, that if we see biologicals post-approval changes guidelines, they have very clear document requirement guidelines and the approval guidelines in biologicals, but in post-approval changes, we have to go to the SUGAM and see the list of the documents which we require to upload on the SUGAM portal. But in the documented, if we would get the same, and it would be easier for us to get the documents on time.
Definitely will again made some sort of guidance document for what are the requirement specific to the minor as well as the major post-approval changes. Thank you.
Thank you. We can take one more question from the audience on the front seat, please. In the middle.
Good afternoon, sir. For Class C, the CDSU's audit is done, but the licenses are not issued so far. Can you highlight on that, please?
So your question is, audit has been done and licenses have not been issued.
Yeah, sir.
Yeah, so I would request Asim. See, these are, I think this forum is not for these kind of questions, if they are specific to you, you can actually discuss with CDSU and sort that out. Okay. There must be some reason for that. I mean, let's use this platform for a generalized question which benefits the whole industry.
Sure.
Yeah, maybe in your particular cases there is some major non-deficiency was observed by the authority. That's why it is not that once the audit is completed, then immediately you will get the manufacturing license. Maybe there may be some, but that case to case basis we can say that. But that is specific case we need to have what is the actually reason. We will see and we will do the needful. But only thing is there may be some major requirement which is not yet submitted to the licensing authority. That's why the license is not issued.
They told me that all the Class C licenses will be issued after October only.
For that new regime, then when it will come, because in the online there is no system for once the license is approved, immediately the license is issued on the particular approval date. And as per the law, the effective date is 1st October 2022-23. Thereby we are, after reviewing the application, we are asking the applicant to just wait. Once that licensing regime will come, then only you will again submit. Immediately your application has been processed and will issue the license with the effect from the 1st of October 2020.
Thank you so much.
Thank you.
Thank you all the participants for asking the question. It's heartwarming to see the open dialogue between the manufacturers and the regulators. May I now turn to Dr. Raghuvanshi for his closing remarks for the session.
So thanks a lot, Satyamji. So at the end, I would again bring out couple of points. First of all, I'm as a regulator, head of NRA, I'm actually very happy to see this vibrancy and the kind of questions which are coming. That shows that the whole system is very active, and in fact it also brings out the passion with which the whole industry and entrepreneurs are working on this. So that's a very big positive, and I think this is going to help this whole domain. Let's keep this. From regulatory side, I can ensure that we are completely open to your interaction, your suggestions, your questions, and we will jointly together grow this industry. That is one. Second, there were some questions from state about the capacity building and technical training. So there is also a proposal in place which we, a couple of months back, we started that discussion with the state during our zonal meetings, that if one state wants a dedicated training on a specific topic, they can request us. They will have to do the local arrangements. We will arrange for the resource, and we will fly down to your place and do that 1, 2, 3, 4, 5, whatever is required. That training we will do. So we are completely open to it. You can write to us and we will do that. That is part of our ongoing capacity building program. And one very important point I wanted to also bring, that as I said, the regulation is also growing. Regulators are also understanding this domain. Dialogue is very important in this phase. And let's keep that communication channel open between both the customer and the regulator. That will help this whole domain to increase its understanding. The system will grow and become robust with this exercise of discussion communication, with an understanding that don't expect that whatever you bring out will be solved immediately or agreed by government 100%. If that doesn't happen, that does not mean that communication channels should be stopped. So with this commitment, I think I would stop it here and thank all of you again for coming here and participating so openly in this discussion. Thanks a lot.
Thank you very much, all the speakers and the panelists and the moderator, sir, for steering this session so wonderfully. And also the audience, thank you for your active participation. We now would like to present the token of gesture to all the panelists and the moderator, sir, will request Saurabh Shekhawat, Vicky Delhi to do the honors, please. Thank you, and I request everyone to kindly step forward for a group photograph. In just few minutes from now, we will proceed towards the valedictory session. And thereby, we close down for the 3-day wonderful session here and also the expo. And then we will proceed for the lunch. I request everyone to kindly be seated. repeat, put your mobile phones on silent mode or vibrating mode. Thank you. Ladies and gentlemen, please help me extend a very warm welcome to Honorable Minister of State for Chemical and Fertilizers, Government of India, Shri Bhagwan Khubaji. It's indeed a pleasure to have you over here, sir. We also extend a warm welcome to Shri Rishikesh Bhai Patel, Honorable Health Minister, Government of Gujarat. Together with them, we have Ms. S. Aparna, Secretary, Department of Pharmaceuticals, Ministry of Chemicals and Fertilizers, Government of India. Shri Ravindra Pratap Singh, Joint Secretary, Department of Pharmaceuticals, Ministry of Chemicals and Fertilizers, Government of India. Mr. Vivek Shah, CEO, Merrill. And Mr. Rajiv Gandhi, Chairman, Gujarat State Council, FICCI. We welcome all the esteemed dignitaries on the dais. It is indeed a pleasure to have you all over here for the valedictory session. Those who are standing, I request you to kindly take up your seats, please. We would now like to felicitate our esteemed dignitaries on this stage with regards to their august presence. Foremost, I would request Ms. S. Aparna, Secretary, Department of Pharmaceuticals, to welcome Shri Bhagwan Khubaji, Honorable Minister of State for Chemicals and Fertilizers, with a green certificate and a shawl. Thank you. Thank you, Madam. Would now request Shri R.P. Singh, Joint Secretary, Department of Pharma, to kindly welcome Honorable Health Minister of Gujarat State, Shri Rishikesh Bhai Patel, with a green certificate and a shawl. Thank you. I would now request Mr. Rajiv Gandhi, Chairman, Gujarat State Council, FICCI, to kindly welcome Ms. S. Aparna, Secretary, Department of Pharma. Would now request Mr. Rajiv Gandhi to kindly welcome Shri R.P. Singh, Joint Secretary, Department of Pharmaceuticals. Thank you. And would also request Mr. Rajiv Gandhi to kindly welcome Mr. Vivek Shah, CEO, Merrill. Thank you. Now, in order to commence the valedictory session, I request Shri R.P. Singh, Joint Secretary, Department of Pharmaceuticals, to deliver the welcome address. Over to you, sir.
Good afternoon. Shri Bhagwan Khuba, Honorable Union Minister of State for Chemicals and Fertilizers, Government of India. Shri Rishikesh Ganesh Bhai Patel, Honorable Health Minister, Government of Gujarat. Ms. S. Aparna, Secretary, Department of Pharmaceuticals, Government of India. Shri Rajiv Gandhi, Chairman, FICCI Gujarat State Council. Shri Vivek Shah, CEO, Merrill Life Sciences, distinguished guests from central and state government, industry and media, and dear participants. Today, it is a momentous occasion as we gather here for the valedictory session of the incredible journey of India's first MedTech Expo. It has been a privilege to witness the convergence of innovation, knowledge, and collaboration in the field of medical device technology. As we conclude this expo, we find ourselves enriched with insights connections, and a renewed passion for advancing healthcare industry. In the past 3 days, we have showcased cutting-edge technologies that have the potential to transform patient care, enhance diagnostics, and revolutionize treatment methods. From the state-of-art imaging systems to precision surgical instruments, from wearable health monitors to AI-driven diagnostic tools, each exhibit has painted a picture of brighter and healthier future in our minds. As we bid farewell to the 3-day Expo, I am confident that the future of India MedTech device sector is bright and will position India as a global leader. I once again thank you all for your participation and welcome you for this valedictory session. Thank you.
Thank you very much, sir, for your warm welcome words. We appreciate them. I would now like to welcome Mr. Vivek Shah, CEO, Merrill, to share his thoughts on this occasion. Over to you, sir.
Good afternoon. Honorable Minister of State for Chemicals and Fertilizers, New and Renewable Energy, Shri Bhagwant Kubaji. Honorable Health Minister, Government of Gujarat, Shri Rishikesh Patel ji. Honorable Industry Minister, Government of Gujarat, Shri Balwant Singh Rajput ji. Secretary, Department of Pharmaceuticals, Madam S. Aparna ji. Joint Secretary, Department of Pharmaceuticals, Shri R.P. Singh ji. Chairman of Gujarat State Council, FICCI, Rajiv ji. And all my industry colleagues. Thank you for giving us this opportunity. On behalf of the MedTech sector, I would like to thank and express my sincere gratitude to our Honorable Minister, Union Minister for Health and Family Welfare and Chemical and Fertilizers, Shri Mansukh Mandaviya ji, and Madam S. Aparna, Secretary, Department of Pharmaceuticals, for organizing such a unique event by bringing together all the stakeholders, including the research institutes, regulators, government officials, and co-branding it alongside the G20 Health Working Group, thereby providing a great opportunity for the Indian MedTech industry to showcase its capacity and growth potential. I would like to thank our Honorable Minister of State for Chemicals and Fertilizers, New and Renewable Energy, Shri Bhagwant Kubaji, for giving his valuable time and attending this event. I would also like to thank our Honorable Health Minister Shri Rishikesh Bhai Patel ji and Government of Gujarat for extending their valuable support for organizing this first edition of Indian MedTech Expo at Gandhinagar. Merrill, being an Indian company headquartered at Gujarat, is delighted and proud to be part of this event. For the past 2 days, we all have observed a tremendous response from all the stakeholders, including the international delegates from across the world. We are immensely grateful to our distinguished speakers, exhibitors, and participants who have contributed their expertise, insights, and innovative products to this event. Merrill, being founded in 2006, I think our vision has always been aligned to the growth drivers of the Indian medical device industry, including innovations in research, skill development, employment generation, affordability with quality, and India's brand position across the globe. Since its inception, Merrill has been manufacturing medical devices indigenously and currently has a bouquet of more than 150 state-of-the-art technologies to be provided across the world. And we have wide canvas of verticals like cardiovascular, orthopedics, endosurgery, ENT, robotics, and other products. Merrill today operates in more than 150 countries with global subsidiaries in 23 countries to provide service across the globe. truly exemplifying the vision of our Honorable Prime Minister Shri Narendra Modi ji of Make in India and the world. We believe with support and guidance from research institutions like ICMR and through industry academics, collaboration with industries like institutes like NIPER, the Indian medical device industries can take forward the innovation and research in the MedTech sector to the next level in India. We ourselves are continuously working on developing technologies like robotics and AI, which we believe is the future of the MedTech sector. We strongly believe that under the dynamic leadership of our Honorable Union Health Minister and Family Welfare and Chemical and Fertilizers, Shri Mansukh Mandavia ji, who has always been taking a holistic approach through stakeholders consultations, many schemes and regulations will be shaping up aligned to the National Medical Device Policy, which will help create a growth ecosystem for the Indian MedTech sector. We will continue to invest in new technologies and innovations and are committed to support the Make in India and Atmanirbhar Bharat initiatives and contribute to the vision of our Honorable Prime Minister Shri Narendra Bhai Modi ji to make India a global manufacturing hub for medical devices. Industry is eagerly looking forward to the second edition of this event. Medical device industry needs a government platform like this. Like all other international calendar events, this event should also be programmed yearly. Next dates should be finalized by DOP immediately so that international buyers can plan well in advance. I am confident that with such strong foundation created by DOP and driven by industry, second edition of the Indian MedTech Expo will be much more grandeur next year, and we are looking forward for many more such opportunities to interact and showcase the innovations of India to all the stakeholders. Last but not the least, a special note of appreciation goes to FICCI, especially Mr. Praveen Mittalji and his entire team who have worked tirelessly behind the scenes to ensure smooth operations and a seamless experience for everyone involved. Thank you once again. Jai Hind, Jai Bharat.
Thank you so much, sir, for your kind words of appreciation. Now, with pleasure, would like to welcome Ms. S. Aparna, Secretary, Department of Pharmaceuticals, to deliver her special address. Over to you, ma'am.
Namaskar, good afternoon. A very warm welcome to our Honorable MOS, Shri Bhagwan Khuba Sahib, and to our Honorable State Minister for Health in Gujarat, Shri Rishikesh Patel Sahib. Very warm welcome also to all the dignitaries present here from industry and from regulators and state governments. It is with immense satisfaction that today we are here in the valedictory session of the first Indian MedTech Expo 2023. Sir, we began planning this event last year, sometime in September. Originally, we had planned to have it in Delhi in December. Then it got postponed due to various reasons. And I believe this is one of those cases where delay has only contributed to the greater success of the event. And I am happy that we could finally host it at Gandhinagar, one of the most progressive states in terms of industrial investment, and ensure very wide-scale participation. I would like to, at the outset, thank industry, all individual members, as well as all the associations who have participated in this expo. This expo would not have been held, would not be called a success unless industry had participated in such large numbers. So I would like to begin by thanking industry, all the members, all the associations for so generously being a part of the India MedTech Expo. Sir, as you are aware and our audience also knows, the Department of Pharmaceutical is responsible both for pharmaceuticals as well as medical device policy. In the last few years, a number of measures have been taken, and we have talked about it both in the inaugural session as well as in the different technical sessions that we had. The National Medical Device Policy 2023, approved in April by the Union Cabinet, is our overall policy direction for the development of the sector. Under that policy, several measures are being taken. But today I would only like to talk about the Expo and what, in my opinion, humble opinion, it has achieved. This Expo has achieved, in my view, three important milestones or features. Number one, it has provided a platform for all stakeholders to come together. So we had the state governments, we had the central departments including skill development, social justice, health department, health research, DOP, etc. We had the regulators, we had the investment promoters, we had the important procurement agencies from state and from central government. We had industry representatives from global MNCs, from large Indian players, exporting manufacturers, MSMEs, startups. So we had one forum where we could bring together all the stakeholders who need to be together, think together, act together for the development of the sector. Second achievement or feature of the Expo has been that it has acted as a signal. Sir, it has signaled the importance that the Government of India and the participating state governments place on the development of the medical devices sector. It is a strong signal that government is here to support the sector on an accelerated growth path. This sector has the potential, as all of us know, to grow to a size of about $50 billion, and we want to assure industry that government is there to facilitate and promote your growth to that level. Third, it also signaled a change in perspective. Sir, I have been in the sector for 3 years, and always we used to compare pharmaceuticals and medical devices. We used to feel that the pharmaceuticals is an export-oriented sector where almost 50% of the output is going into export, and we used to feel that medical devices sector is an import-dependent sector. This Expo has showcased the technical and commercial ability of Indian domestic medical device sector. All of you who have visited the exhibition could not have failed to be impressed by the quality, the innovation, and the commitment of Indian manufacturers, not just of the low-end consumables, but even the high-end electronic equipments, high-end technical equipment, and have seen for yourself the quality of the products that are being made in India as part of the Atmanirbhar Bharat. You would also have seen the players who are importing products showing interest in a growing market that is India, because of its demographic profile, because of the increasing purchase power, because of the increasing attention to universal health. India is both very important as a market and as a producer. I think this was showcased in the Expo, and for me that is a very important message that needs to go out to the whole world, that Indian medical device sector is in the takeoff phase. It is going to only grow, develop, innovate, and provide not only for our country but for the world. We also saw very successful interaction between buyers and sellers, many of the foreign buyers who came, many of the delegates who came already placed orders, sir. Even some of the delegates who are not commercial buyers were impressed by the products that were available, and they have already shown interest. So I do hope that industry will take heart from the efforts that have been made by DOP with all organizing partners led by FICCI and of course all the industry association and the wholehearted support of the government of Gujarat. Sir, I would like to place on record my great appreciation of the support we have received from the government of Gujarat, sir, not only at the venue, but also from the health department, from the regulator, Dr. Koshia, who is present here today. We are not a very large organization, but with your support, we could put up a very large show for our stakeholders, that is the medical devices industry. Last but not the least, I would like to say the fourth feature of this expo has been the quality of discussions we had in these sessions, and these I hope will inform the strategy not only of individual companies but also the whole sector in how to go forward in the Amrit Kal and ensure that we contribute to India being a developed nation by 2047. I would like to once again thank my team, sir. It is your guidance as minister who has enabled us to do so. It is the hard work put in by my joint secretary, Shri R.P. Singh, by entire team of officers present here, sir. It is the support we received from state government and the huge organizing capacity which was demonstrated by FICCI. Of course, Rajiv ji is here, but I must say, lot of legwork put in by Praveen Mittal and his team. Thank you so much, FICCI, being a part of this. Vivek ji has suggested that we should announce the date and venue of the next expo. Certainly, we will take it up with Honorable MOS and Minister for Chemicals, and very soon announce the date and venue for the next, hopefully, God willing, next IMTE 2024. So all of you can start preparing to participate with new products, new devices and new enthusiasm. A very, very warm thank you to all of you at this valedictory session. Namaste.
Thank you very much, Madam, for your informative address and also the thank you note. अब मैं इस समापन समारोह में पधारे गुजरात राज्य के माननीय स्वास्थ्य मंत्री श्री ऋषिकेश भाई पटेल को अपने विशेष संबोधन के लिए उत्साह के साथ आमंत्रित करना चाहती हूँ।
गुड आफ्टरनून। कैसा रहा गुजरात? कैसा रहा गुजरात आप सब लोगों को हमारे आतिथ्य का? आपसे तो कोई जवाब आ ही नहीं रहा है। मान ही लेता हूं कि आपको यहाँ कोई दिक्कत नहीं हुई होगी, लेकिन आज हमारे बीच श्री भगवंत खुबा जी, ऑनरेबल मिनिस्टर ऑफ स्टेट केमिकल एंड फर्टिलाइज़र, गवर्नमेंट ऑफ इंडिया के हमारे साथ हैं। साथ में एस अपर्णा जी, सेक्रेटरी डिपार्टमेंट ऑफ फार्मास्यूटिकल्स, श्री आरपी सिंह जी, राजीव गांधी फिक्की के चेयरमैन, विवेक शाह हमारे बीच में आज उपस्थित है। और आप सभी G20 के समूह में सब लोग आए। यहाँ पर 3 सेक्टरों में, फार्मास्यूटिकल, मेडिकल डिवाइसेस और साथ में यहाँ पर भारत के अंदर हमारे लिए बहुत ही बड़ा गौरव की बात ये रही कि G20 का हमें नेतृत्व मिला। पूरे सभी देशों को यहाँ पर बुला के उनके हेल्थ मिनिस्टर और मिनिस्टरियल कॉन्फ्रेंस, विचारों के आदान प्रदान और आदान प्रदान के साथ साथ कहाँ पर क्या कहाँ सहयोग हो सकता है, और साथ में हमारे भारत के अंदर जो फार्मास्यूटिकल्स के अंदर जितने भी बिग प्लेयर है, स्टार्टअप्स है, उन सबको बढ़ावा देने के लिए यहाँ पर जो यहाँ एक्सपो भी लगाया, मैंने कल विजिट भी किया, और विजिट के दौरान मैंने देखा हमारे यहाँ इतना बड़ा टैलेंट है, टेक्नोलॉजी भी नई इन्वेंशन कर सकते हैं, ऐसा बहुत सारे एंटरप्रेन्योर हमारे बीच में उपस्थित है, लेकिन कहीं न कहीं मौका नहीं मिला, कहीं इतना फील्ड नहीं मिला। लेकिन आदरणीय नरेंद्र भाई मोदी के विजन के अंदर हर सेक्टर के अंदर, इसमें भी खास करके फार्मास्यूटिकल और मेडिकल डिवाइस के सेक्टर के अंदर बहुत सारे नए आयाम, नई तकें यहाँ के भारत के आकाश में, भारत के गगन में, भारत की धरती पर अपना जो टैलेंट है बहुत निखर के आए, और यहाँ पर टेक्नोलॉजी की आयात करके कुछ बनाए ऐसा नहीं, लेकिन टेक्नोलॉजी ग्रीवेंसेस भी यहाँ पर बहुत सारे संशोधन भी हो, यहाँ की टेक्नोलॉजी बाहर के देशों में भी जाए, इस तरह का एक बहुत बड़ा प्लेटफॉर्म और पॉलिसी के साथ हमें दूसरे प्लेयरों के साथ, दूसरे देशों के साथ कॉम्पीट भी करना है, और यहाँ के जो भी मैन्युफैक्चरिंग हम डिवाइसेस बनाएंगे, वो डिवाइसेस दूसरे देशों भी हमारे यहाँ से खरीद करें, ऐसा बहुत बड़ा प्लेटफॉर्म देने के लिए ये भारत सरकार, और ख़ास करके मैं भारत सरकार के मंत्री आदरणीय मनसुख भाई मांडविया जी और मिनिस्टरियल जो कॉन्फ्रेंस G20 की गुजरात में रखी गई, उसके लिए भी धन्यवाद करता हूँ, क्योंकि गुजरात का इकोसिस्टम समझने के लिए भारत के और बाहर से भी आए सभी लोगों को एक यहाँ आने के बाद उनको एक पता चलेगा कि यहाँ की असिस्टेंस गवर्नेंस है, साथ में पब्लिक भी, यहाँ की प्रजा भी उनके साथ सहयोग करने में भी अपेक्षा रखती है, और साथ में आप सब लोग यहाँ पर कहीं न कहीं छोटे बड़े बिजनेस में और ख़ास करके मेडिकल डिवाइसेस के बिजनेस में यहाँ पर आए, तो आप सब लोगों की दिक्कत, आपके बिजनेस के लिए की दिक्कत, और उसके लिए हम क्या कर सकते हैं, एक ही इकोसिस्टम बनाने के लिए यहाँ पर हमने बल्क ड्रग पार्क और साथ में डिवाइसेस पार्क भी राजकोट और जम्बूसर में ऐलान भी किया है, और बहुत ही जल्द में ये वो पूरा सिस्टम एक ही जगह पे सब आपको मिलेगा। इस तरह का इंफ्रास्ट्रक्चर खड़ा करके आपको बहुत बड़ी, आपको आने के लिए न्योता भी दे रहे हैं, और रेड कारपेट भी आपके पास है, हमारे पास है, जो आपके पास ही आने वाली है। तो अगले समय के अंदर जब आप यहाँ पर आओगे, तब मैं सोचता हूँ कि भारत भर के जितने भी टैलेंटेड अपनी वर्कफोर्स है, जितने भी उद्योगपति है, एंटरप्रेन्योर है, यहाँ पर आए, स्टार्टअप को भी इकोनॉमी बूस्टअप देने के लिए गुजरात सरकार ने बहुत सारा काम भी किया है, और मेडिकल डिवाइस के क्षेत्र में हम बहुत सारी कंपनियाँ यहाँ पर पहले से काम कर रही है, लेकिन MRI, CT स्कैन, हाई एंड वैल्यू एडिशन वाले जितने प्रोडक्ट अभी हम यहाँ नहीं बना पा रहे हैं। यहाँ हम हार्ट के लिए, आई के लिए और डिस्पोजेबल सब चीज़ें बना लेते हैं, लेकिन हाई एंड वैल्यू वाले जितने प्रोडक्ट है अभी कहीं न कहीं हमारी कमी रही है। हम सबको भी न्योता देते हैं कि आप गुजरात में आइए, आपकी जो भी मुश्किलें होगी, जो भी सुझाव होंगे, हम उसको असिस्ट करके, उसको मदद करके आपको यहाँ एक बहुत बड़ा इकोसिस्टम भी देंगे। और साथ में जब आप सब लोग यहाँ पर आए हैं तो फार्मास्यूटिकल बिजनेस हमारा, उसमें भी फॉर्मुलेशन में हम इंडिया में सबसे आगे हैं, लेकिन कहीं न कहीं बल्क ड्रग के लिए पूरे हम दूसरे देशों पर निर्भर है। तो यहाँ पर आप ये सब बनाइए, दोनों का लाभ गुजरात सरकार की ओर से लेके हमारे पूरे भारत के लिए, और गुजरात के ग्रोथ इंजन में आप भी शामिल होने के लिए आप सबको भी न्योता देता हूँ। आप सब यहाँ गुजरात की धरती पे आए और धरती पे के आके हमारा उत्साह वर्धन भी किया है, इसलिए आप सबका भी धन्यवाद करता हूँ। थैंक यू वेरी मच।
माननीय मंत्री श्री, आपके उत्साहपूर्ण शब्द एवं सहकार के लिए आपका भी बहुत बहुत धन्यवाद. Given the significance of innovation and entrepreneurship for the MedTech sector, the government aims to felicitate the startups and acknowledge their efforts and achievements towards building innovative products and solutions for the healthcare sector. For this purpose, a jury evaluation was carried out during the event for the startups that have participated in the Startup Pavilion. The jury members were Dr. Shyam Vasudev Rao, founder and director of Forest Health, Renalix and RxDHP. Mr. Sasi Kumar, Managing Director of Phoenix Medical Systems. Mr. Vibhav Garg, Director, Health, Economics and Government Affairs, India Hub and ASEAN Boston Scientific. Dr. Kabir Mahajan, Associate Director, Mahajan Imaging and Labs. And Mr. Suyash Ratna Tripathi, Assistant Manager, Startup India. The official tabulation was carried out by our knowledge partners, EY, Ernst & Young. We thank all of them for their kind and selfless services. The startups have been evaluated in 4 different categories: scalability and market potential, innovation and technology, social impact, and women-led innovation. And we have 3 winners for each category. I would now request the dignitaries on the dais to please felicitate the winners by presenting them the certificates of appreciation and a memento. To start first with, Lemmy Dotfit, KML Health Private Limited. It's a women-led innovation. Lots of big round of applause for the women-led innovation in the startup. We welcome her and congratulate Madam. Congratulations, madam, and good luck. Next, second is Pragmatech Healthcare Solutions Private Limited for the women-led innovation. Congratulations and best wishes. Next we have Ainoshi Care, Women-Led Innovation. Congratulations, madam. Many congratulations. Next we have Neo Motion Assistive Solutions Private Limited in Social Impact. Congratulations. Next we have with us Niramay Health Analytics Private Limited for Social Impact. Congratulations and good luck. Next we have with us Jeevtronics Private Limited for Social Impact. Good luck to you. In the Innovation and Technology category, first we have Crimson Healthcare Private Limited. Congratulations. Next is ISMO Biophotonics Private Limited, Innovation and Technology category. Congratulations. NemoCare Wellness Private Limited, bags for innovation and technology. Congratulations. Now for the scalability and market potential category, first we have JC Ortho Hill Private Limited. Many congratulations. Next we have Neodox Healthcare in scalability and market potential. Congratulations. Last but not the least, we have Sunfox Technologies Private Limited for scalability and market potential. Many congratulations. Congratulate all the awesome winners and extend good wishes for a best of the future. आइए इस समापन समारोह में विशेष रूप से पधारे माननीय श्री भगवंत खुबा, रसायन एवं उर्वरक मंत्रालय के राज्य मंत्री श्री को उत्साह के साथ समापन संबोधन के लिए आमंत्रित करते हैं।
इंडिया मेडटेक एक्सपो 2023 इस 3 दिवसीय अद्भुत यशस्वी के रूप में समापन का कार्यक्रम में उपस्थित गुजरात के हेल्थ मिनिस्टर भाई श्री ऋषिकेश गणेश जी, अपने विभाग के सचिव श्रीमती एस अपर्णा जी, मंच पर उपस्थित श्री आर.पी. सिंह जी, फिक्की के गुजरात के चेयरमैन श्री राजीव गांधी जी और सीईओ मेरिल श्री विवेक शाह जी, और देश और दुनिया से पहली बार भारत के अंदर डिपार्टमेंट ऑफ फर्टिलाइजर एंड केमिकल्स के विभाग, फार्मास्यूटिकल विभाग और फिक्की के साथ मिलकर के सारे इनोवेटर्स, मैन्युफैक्चरर्स, एकेडमिया मार्केटर्स, ऐसे सारे एक साथ एक छत के नीचे लाने का काम करने के वजह से मैं अपर्णा जी को और फिक्की को आप सभी के ओर से अभिनंदन करता हूं। हेल्थ सेक्टर राइजिंग सेक्टर है, विशेष करके देश के अंदर जो मेडिकल डिवाइस सेक्टर है, अभी तक हर क्षेत्र के अंदर भारत अन्य देश के ऊपर निर्भर रहता था और भारत के जनता के सामर्थ्य के ऊपर और परिश्रम के ऊपर कोई शक नहीं। विदेश में जाकर के अपना ही युवा वहां पर इनोवेशन करना, परिश्रम से देश का नाम रोशन करना, लेकिन भारत में इस सोच का कमी के वजह से हमने जितना अन्य देश वृद्धि किया है, भारत ने नहीं किया था। लेकिन पिछला 9 साल से परम आदरणीय नरेंद्र मोदी जी सरकार की सोच बदल दिया, जनता की सोच बदल दिया और सारे इन्वेस्टर्स का मनोबल बढ़ाने का नीतियां बनाई। उसी के कारण भारत नरेंद्र भाई मोदी जी का सोच के साथ आत्मनिर्भर बनने के सारे लक्ष्य लेकर के आगे बढ़ रहा है। भाइयों और बहनों, आप सभी ने पिछला 3 दिनों से जो कि पहली बार इस तरह का प्रयास हुआ है और इस प्रयास को अगर हम बड़ी सक्सेस के रूप में अगर हम देखते हैं तो यदि अगर कोई कारण है तो पिछले 3 दिनों में लगभग 10,000 से ज्यादा विजिटर्स ने आकर के इसमें रुचि लेकर के उसने राय दिया है। उतना ही नहीं, करीब 225 कंपनियां एमएसएमई को पकड़ करके आज इस एक्सपो का लाभ उठाने के प्रयास किया। करीब देश के 7 राज्यों ने इस यशस्वी एक्सपो के बीच उपस्थित रहकर उनका आदान प्रदान और योगदान करने का प्रयास किया है। उतना ही नहीं, R&D के पेविलियन के बीच करीब 58 प्रोजेक्ट्स 42 कंपनियों के जरिए यहां पर प्रदर्शन किया है। तो इसके साथ में हमारा देश के युवा करीब 80 स्टार्टअप्स इसमें भाग लेकर के अपना सामर्थ्य और अपना योगदान का प्रयास किया है। इतना ही नहीं, करीब 74 फ्यूचर टेक्नोलॉजीज आगे आने वाले दिनों में नया टेक्नोलॉजी को लेकर के या डायग्नोसिस हो, सर्जरीज हो, ट्रीटमेंट हो, उस दिशा में लेके जाने का प्रयास भी किया है। और इसी के साथ 8 गोल्ड स्पॉन्सर्स और 10 सिल्वर स्पॉन्सर्स ने भी 3 दिवस में उनका योगदान रहा। देश के अंदर रेगुलेटरी एजेंसीज like Department of Pharmaceuticals, जम पोर्टल, जो कि जम पोर्टल आज लाखों करोड़ों का उस पोर्टल के माध्यम से व्यापार हो रहा है और किसी को कोई दिक्कत नहीं, इस ढंग का जम पोर्टल के ओर से हो रहा है। ICMR, IPC, CDSCO, NPPA और BIS ऐसे रेगुलेटरी एजेंसीज भी पार्टिसिपेशन लेकर के नया उद्योगियों को और नया सोच के लेकर के देने वालों को मदद करने के लिए उन्होंने भी काफी आपके साथ वाद संवाद और आपके सुझाव को बड़ी स्वागत करते हुए और उसको गंभीरता लेके हुए भारत सरकार को सुझाव का ऊपर कार्रवाई करने का मदद होगी। भाइयों और बहनों, 3 दिन लगातार आपका अनेक सेशंस, विचार आदान प्रदान हुआ और उसके साथ कुछ चीजों के ऊपर अपने खुद को भी मालूम नहीं था, उसको जानने का अवसर मिला और देश के अंदर अवसर का भंडार अपने को जानने का भी मौका मिला। आज प्रधानमंत्री नरेंद्र भाई मोदी जी प्रधानमंत्री बनने के बाद हर क्षेत्र के अंदर इतना विश्वास और भरोसा किया है, इसी के कारण आने वाला 25 साल में प्रधानमंत्री जी का एक दूरदृष्टित्व का लक्ष्य लेकर के प्रधानमंत्री जी हर बार कहते हैं, सपना बड़ा देखो और सपना पूरा करने का परिश्रम करो और समस्याओं को समाधान करने का ताकत बढ़ाओ। तो आज इस क्षेत्र के अंदर भी हर भारतीय अपने अपने योगदान देने के लिए निर्णय और संकल्प कर चुका है। यही दिशा में हमारे भारत सरकार, हमारे डिपार्टमेंट मेडिकल डिवाइस पार्क बनाने का निर्णय और नया पॉलिसी लेकर के 2023 में आया है। इसी के साथ PLI स्कीम्स, पहले कई उत्पादकों ने सोचते होंगे कि भारत सरकार हम करना चाहते हैं लेकिन हमको सरकार से मदद नहीं मिलती और सहयोग नहीं मिलती, लेकिन मोदी जी का कार्यकाल में स्वयं हमारा डिपार्टमेंट मैन्युफैक्चरर्स के पास पहुंचती है और सरकार की लाभ उठाने का सारे इंफॉर्मेशन पास करती है। तो ऐसी सरकार में हम सभी लोग जितना अपने पास क्षमता और ताकत है इन्वेस्टमेंट करने का, मार्केटिंग करने का, उत्पादन करने का, सारे एकजुट होकर के यदि हमारा लक्ष्य को आगे बढ़े तो निश्चित रूप में ये इमर्जिंग सेक्टर एक लाभ देने वाला सेक्टर का रूप में उसका लाभ आपको मिलेगा। आने वाला 25 साल में देश का इकोनॉमी आज जो 3.3 है, आने वाला 4 साल के अंदर 5 ट्रिलियन इकोनॉमी बनेगा। जब भारत को आजाद मिलके 100 साल होगा तब करीब दुनिया अंदाज कर रही है कि करीब 32 से लेकर के 42 ट्रिलियन डॉलर की इकोनॉमी होगी। जो हेल्थ सेक्टर इमर्जिंग सेक्टर है, इस सेक्टर के भी कंट्रीब्यूशन बड़ी मात्रा में संभव है। इस कारण आप सभी ने 32 से लेकर के 42 ट्रिलियन डॉलर इकोनॉमी बनाने का अपना अपना कंट्रीब्यूशन देने का बड़ा लक्ष्य भी होना चाहिए और वो अवसर भारत के पास है। दुनिया के सबसे बड़ा युवा ताकत अगर कोई देश में है तो भारत में है और भारत में आज स्टेबल गवर्नमेंट और आने वाले दिनों में भी स्टेबल गवर्नमेंट भारत की जनता चाहती है। तो इन्वेस्टर्स को सबसे ज्यादा अगर कोई सेफ और सिक्योरिटी सोचता है तो स्टेबल गवर्नमेंट, वो भारत का नागरिकों को भी समझ चुका है कि स्टेबल गवर्नमेंट आने से देश के अंदर विशेष करके अर्थव्यवस्था के अंदर कितना बड़ा उछाल आएगा वो हम देख रहे हैं। तो इसी के कारण फिक्की और डिपार्टमेंट ऑफ फार्मेसी ने बहुत ही अच्छा कार्यक्रम का रचना की और मेहनत की। उसके परिणाम ये यशस्वी रूप से समापन हो रहा है। तो मैं फिक्की को, डिपार्टमेंट को और देश और दुनिया से आए हुए सभी मैन्युफैक्चरर्स, बायर और सेलर्स, इनोवेटर्स, स्टार्टअप्स, आप सभी को मेरे ओर से बहुत बहुत अभिनंदन और धन्यवाद देना चाहता हूं और आपका आने वाले दिनों में आपके बड़े सपने साकार होने का शुभकामनाएं करता हूं। जय हिंद।
माननीय मंत्री महोदय, आपके प्रोत्साहनपूर्ण शब्दों के लिए आपका भी हम बहुत बहुत धन्यवाद करते हैं। Would now like to welcome Shri Rajiv Gandhi, Chairman, FICCI, Gujarat State Council and CMD, Hester Biosciences, to kindly extend the vote of thanks.
Good afternoon, everybody. This gathering and the attendance for this conference and for the Expo has been overwhelming. I begin my vote of thanks by thanking Shri Bhagwant Khuba, Honorable Union Minister of State for Chemicals and Fertilizers, Government of India, Shri Rishikesh Patel, Honorable Health Minister, Government of Gujarat, Ms. S. Aparna, Secretary, Department of Pharmaceuticals, Ministry of Chemicals and Fertilizers, Government of India, Shri Ravindra Pratap Singh, Joint Secretary, Department of Pharmaceuticals, Government of India, and Mr. Shah from Merrill Life Sciences for attending the Indian MedTech Expo 2023 and gracing the valedictory session of India MedTech Expo 2023. Thank you all. The Expo provided us with an everlasting experience and gave us some amazing insights of medical device industry. India MedTech Expo witnessed 3,670 visitors on 17th August and 5,723 visitors on 18th August, totaling to nearly 10,000. In addition, 4,157 business meetings were held through the buyer-seller meet. Such overwhelming participation and efforts of all stakeholders show a promising, bright future of the Indian medical device sector. I would like to mention a total of 80 startups participated in the event, and the Research and Development Pavilion saw a participation of 42 companies and institutions with 58 unique R&D projects showcased. The future pavilion provided insights into 74 future technologies and products from 65 companies and organizations. While we have seen innumerable attendees for the conclave from across India, especially from Gujarat and more specifically from Ahmedabad, in fact, we were told that every pharma company in and around Ahmedabad has sent their representatives to attend the conference as well as visit the Expo. We have many international delegates too for this Expo. A special thanks to all the international delegates who have come with a hope and now would be returning back with confidence, with a thought that they can rely on India and Indian companies and for the requirements of medical devices and connected services. FICCI would like to express its sincere appreciation to our distinguished speakers and panelists who shared their expertise, experiences and knowledge in the field of medical devices. Your contributions have provided us with valuable insights that would undoubtedly shape the future of medical technology and patient care. A special note of thanks goes to our sponsors and partners without whose support and collaboration this event would not have been possible. Our commitment to advancing medical innovation is truly commendable and we are grateful for your unwavering support. Lastly, I would like to thank the Ministry of Chemical and Fertilizers, Government of India for organizing this event and continuous guidance, and Government of Gujarat for their support and facilitation. Special thanks to Shri S.J. Haidar, Additional Chief Secretary, Industries and Mines, Government of Gujarat, Shri Manoj Agarwal, Additional Chief Secretary, Department of Health, Government of Gujarat, and Dr. S.J. Koshiaji, Drug Commissioner, Gujarat, for their unwavering support which has made this event a success. Once again, thank you all for being a part of this exceptional medical device event. Safe travels to those returning home, and we look forward to meeting again at all our future endeavors. Thank you.
Thank you very much, sir, for your warm thank you note. With this, we come to an end of the valedictory session. And one more time, we extend our sincere thanks to the esteemed dignitaries on the dais for their august presence. And we also thank the audience and the participants, and also wish good luck to everyone who has participated in our show. This is Dhwani signing off. Goodbye. Please visit the exhibition today because it is open till 5 o'clock only. And do join us for the lunch. Bye-bye.